Hello. Um, good morning. It's morning here in Galway. I'm talking to you here from Galway on a beautiful sunny day on the 29th of May in 2021. Today we're going to have a bit of a discussion about menopause, and there's going to be other speakers joining me today. I will have myself. My name is Lara. I do herbal medicine here alongside Dr. Clare and the clinical team on Sea Road in Galway. And Dr. Clare will be speaking to you towards the end of our talks today. She will be joining you at 1 o'clock today. Before that, after me comes Brita Birmingham, who's been she does menopause research and used to work as a former midwife and a public health nurse. And Linda, who is a nutritional therapist in Pilates. So it promises to be an interesting day, and I look forward to hearing all the other speakers later on today. But to start with, my focus today is to speak to you about the physical symptoms of menopause. And, you know, later on, Dr. Clare will be speaking to you about the more kind of psychological manifestations of menopause, you know, such as sleep disturbance and anxiety and depression. So let's get going. I don't know if I can. So there we go. That might be better. Okay. So what is the menopause, or what is menopause? It's essentially like a transition or transformational process involving often profound physical, psychological, and sometimes sociological changes. So it can have a big impact for women. It affects women very differently, which we'll discuss in more detail kind of later on. But essentially, it's a process that takes time. It's kind of ever evolving and changes kind of as you process through it. So in general, it's kind of between the age of 45 and 55, with the average age of kind of 51 and a half, I believe. I quite like the half bit, so I kind of stuck it in there. The menopause essentially refers to three phases. So when we talk about menopause, we're actually talking about three phases. So we have the perimenopause, which is kind of hormonal fluctuations leading into the menopause, and it commonly lasts about 2 to 8 years, but this can vary again for different women. And I have come across women even having it for 10 years. Essentially, menopause is the point at which there have been no menstrual cycles for a year. And it's obviously important if you are missing menstrual cycles and you're not sure if it's menopause or if it's something else, that it's appropriately checked, because it could be something else as well. So it's important to make sure that it's established whether it's menopause or not. And we'll come back to kind of what kind of approaches are used to kind of assess that in a little bit. Finally, it's the postmenopausal phase. So that kind of happens once the menopause has been absent for 1 year, and then you're kind of moving into the postmenopausal phase. So essentially, there is no kind of reoccurrence of menstrual cycles after that. And if it does happen, it should be investigated. But there are other forms of kind of other terms to be aware of in menopause as well. There's talk of early menopause, which generally happens before the age of 45. So kind of between the age of 40 and 45. There's also a term of premature menopause, which happens kind of before the age of 40. And there can be various reasons for that. And if this is something that's of concern to you, it's always good to talk to your medical team to kind of try and establish what's happening there. Some women experience surgical menopause following hysterectomy or when the ovaries are removed. And you know, obviously hysterectomy can be conducted due to kind of pathologies or other reasons. You can have medically or pharmaceutically induced menopause or medically induced menopause. This can happen following cancer treatment, for example, or if you're on estrogen lowering drugs such as tamoxifen, you can see symptoms and signs of menopause. So as I said, the menopause is a process. It can be mild to severe. About 1/3 of women get it mild, about 1/3 get it moderate, and about 1/3 gets it severe. So it affects every woman differently. I often get questions of how long is this going to last? Am I going to get all these symptoms? Am I, and that's a question. Those are questions that are really hard to answer because essentially every woman is different. And, as I say, it lasts different length of time, different amount of symptoms, different variety of symptoms. Some women get no symptoms at all. It just kind of seems to, one day they notice that there's no menstrual cycle and that's it. While other women go through often a big upheave in wide range of their kind of life. It can impact their right and be quite detrimental for them in many ways. It can fluctuate through the process as well. So you might, often periods become irregular. So you might find that you might have regular cycles and then you miss a period and then you get cycles for 3 months and then you miss 2 cycles and then you get periods for 6 months and then you miss 1 cycle and then you might miss 6 cycles and then get 1 cycle. So it can fluctuate quite a bit during the process. You might also find that other symptoms such as hot flushes and sweating, which are one of the most common symptoms, can come and go a bit. So you can find that 1 month they are really bad and they might last and be very bad for 6 months and then they kind of settle a little bit and then they might get worse again. So it can fluctuate through the process. And it is important, like from a herbal medicine point of view, we always say that it is important to approach menopause individually because of exactly these factors, that every woman experiences it differently and it can fluctuate. So sometimes we need the herbs to kind of fluctuate alongside the woman as she goes through the process. As I said, it can vary in length. Some women, it just kind of seems to happen and there doesn't seem to be any time. It just kind of, boom, is done. While other women, it can kind of feel like it's dragging on forever and ever. And, I often get asked, when is this ever going to stop? Or I've had it for so long. But, as I say, there's a whole wide range of how this can happen. I did mention it can start and settle and start again. And sometimes for some women, it feels like it's kind of marking a new phase of life. For some women, they find kind of empowerment. For some women, it can be involve a grief process. So it can often be quite a reflective phase. And, Dr. Clare might talk a little bit more about those kind of emotional involvements in menopause. So what's happening hormonally? There is decrease in estrogen. That's kind of one of the key factors in menopause. And this is due to the fact that the follicles that we have in our ovaries are reducing. We only get a set of them at birth, and then they kind of slowly decrease as we go through our menstrual phase of life. Progesterone is also gradually decreasing. There's an increase in follicle stimulating hormone, which essentially stimulates the follicles to develop and is released from the anterior pituitary gland. So it is trying to stimulate the follicles to kind of produce because they are not being produced anymore, but it's being unsuccessful. So the estrogen continues to drop and the follicle stimulating hormone kind of keeps going up. There's also an increase in the luteinizing hormone, and both the follicle stimulating hormone and the luteinizing hormone, it has been shown that they kind of approximately every 60 to 90 minutes fluctuate. And there is, it may be that the hot flushes can be linked with this kind of luteinizing hormone release. So that kind of explains why women often experience the hot flushes kind of it comes, you know, kind of every hour or every, you know, but again, we're all different, so we can fluctuate in different cycles. So this is, I quite like this. I came across this and I quite like this as a visual of what's happening. It is a very simplified version of what's happening, and I like my colleagues, Dr. Clare's approach to explaining it a bit like fun fair. You have all the different fairs within the fun fair park, you know, and they are all the different hormones doing different things. So you have the roller coaster, you have the spinny cups, you have all these kind of different hormones doing different things. It isn't quite that linear, but it's an interesting one to show how the hormones can really fluctuate. And you need possibly different approach when you're at the peak of those spikes and when you're at the bottom of those spikes. But essentially it's going up here and then kind of dropping down to a lower level, you know, and that's the kind of new settled place for moving forward. So what about diagnosis and monitoring and testing? I mean, essentially, one of the key things is the clinical history. We all have a story to tell, and it is very important to hear women out and what they've been experiencing and what's been happening leading into menopause is also important, not just the menopausal phase, because sometimes if we've been driving very fast, you know, driving our system very fast, if we've been under a lot of stress or we haven't been sleeping well or things, then, you know, our stress hormones are a little bit out of kilter, or if our digestion isn't great, you know, all these things impact kind of how menopause can potentially develop. So it is important not only to look at what's happening now, but also to look at what's been happening leading into it. Physical examination might take place. You know, this can involve checking for dry skin, dry hair, and, you know, in some cases you might need to have vaginal examination if there's any mid-cycle bleeds or irregular periods or anything like that. Blood tests, including checking the FSH, the LH, and the estrogen levels, but also kind of thinking in broader terms, so checking cholesterol and thyroid function, because they can start to kind of be altered as you go through the menopause as well. So it is about, in some ways you could say it's about kind of pausing and reassessing what's happening. So there's limitations to the blood test, in particular in regards to the hormones, because they fluctuate both daily, weekly, monthly, yearly. It is important to just note that the test that you have is only measuring them at that one particular point in time. So they continue to fluctuate. So it may be necessary to have kind of a couple of tests over time to kind of confirm, you know, kind of findings and things. Other factors of value is having pap smear test, having cardiovascular health check, and having DEXA scan, which I talk about a little bit briefly later on. But just it's that kind of checking in with what's happening. It's worth keeping in mind that unexplained menstrual cycles, unexplained menstrual changes should be appropriately assessed. So it needs to be established that there isn't other reasons for why you're missing periods, you know, such as pregnancy, PCOS, anything like that, that just needs to be kind of ruled out. And I mean, there are a number of other factors as well. So it is important to keep track of your cycles and be familiar with what is usual for you. Are you normally someone who gets 5 days bleeds and 28-day cycles and they're always regular, and then all of a sudden you find that you got 2 days bleed and a 48-day cycle, you know, it can happen that we get one cycle that's a bit out of kilter to what we usually experience, and that can be related to sex, travel or infections, or, you know, being under the weather or stress. So there's a lot of reasons for why that might happen. but if it's of any concern, it needs to be checked out. Menstrual bleed, if there's a menstrual bleed after 1 year of not having had a bleed and you have kind of been confirmed to be in the menopause, that should be appropriately assessed as well. In most cases, it's nothing to be concerned about, but it's important to make sure that there isn't something that is needed to be concerned about. So it's always important to go and have it checked, get the no, all is clear, rather than leaving it and finding out later that it would have been good to check it early. So bone density scan it can be good to have a bone density scan early on in the menopause or postmenopausal phase. It can act like a baseline for future scans. So it can be compared against when you're 70 or 80 or 90 or 105, So it can be quite good like that. And the same goes for like cholesterol and thyroid and other things, blood pressure, other things. So before we move on, I'll just have a little bit of a chat to you about herbs. So herbs are generally best for mild to moderate problems. If you are taking any pharmaceutical medication, it is important to speak to a medical herbalist or a pharmacist so it can be appropriately assessed that there is no negative interactions between the two, or if you're on more medication, obviously between all of them. Yeah. And then herbal medicine always has a focus of holistic approach. So it assists physical and psychological or emotional symptoms collectively. We are one whole human being, so we don't normally separate them like this, but just for today, we decided to kind of split it up like that. It might be kind of easy to kind of just focus a little bit on the physical and then on the kind of more psychological signs and symptoms of menopause. But in general, in the practice here and anytime you're using herbs, they tend to cover the two things. And often we use herbs in formulations. So we blend herbs rather than just using herbs in isolation. So that kind of allows for us to support variety of symptoms or variety of things that may be going on. So it's quite common, for example, that women come in experiencing in perimenopause and they're having irregular cycles, they're having hot flushes and sweating at night time, the cholesterol has creeped up a little bit, the thyroid is getting a little bit wobbly, they're feeling a bit anxious, and the mood kind of goes up and down. And in that, we might use herbs to support the hormones, we use herbs to kind of support the hot flushes and sweating. We use cooling herbs, we use relaxing herbs, we use uplifting herbs for those times when the mood is dipping. We might use herbs to support the liver, to help with cholesterol management, but also directly using herbs to kind of directly work on the cholesterol. And we might even use herbs as well to work on cardiovascular health in general, so as a preventative effect. So you can see that we generally kind of use formulations because we are complex human beings, and even though the herbs as well are kind of complex beings as well, they are generally consisting of multiple constituents that kind of all work together in an interesting, fascinating complexity. But we add to that by mixing them together as well. Just like you would not just eat an onion on its own, you'd like it to be incorporated into a stew or a casserole or something like that. So there's lots of research to back herbs in regards to menopause. This is one example. Wide variety of herbs can be used to support menopausal transition. And this study examined clinical trial papers between 1994 and 2016, and it resulted in that medicinal plants such as sage, lemon balm, valerian, black cohosh, fenugreek, black cumin, vitex, evening primrose oil, fennel, ginkgo, hypericum, which is St. John's wort, ginseng, aniseed, licorice, passion flower, red clover. You can see that there's a lot of herbs that can be used. and this comes back to, it is important to kind of assess what herbs might be particularly helpful for women. But there are herbs out there. They're available over the counter. Can be worth giving a go to kind of start with and see if that works, because often that's enough. But if you're still finding that it hasn't hit the spot for you, then kind of coming to talk to someone like Dr. Clare and I, or another medical herbalist, might be a good plan, so that it can be kind of individually designed for your requirements. So herbal actions for physical symptoms of menopause. I was thinking about this yesterday, and I was kind of drafting up what might be the kind of actions that I would most commonly go for when I'm meeting with a woman who is experiencing menopause. And hormonal support came into my mind, including phytoestrogens. So they are, you could say they're about 300 times, less potent than our own natural estrogen. So it's a bit like the estrogen is dropping and the herbs are kind of coming to greet you. They don't push you right to where you were, but they kind of come and meet with you on the way. So they make the fall a little bit easier. And they also prevent you from dipping right down. So they might have that protective effect of the estrogen moving forward. So the adaptogenic is basically herbs that help the balance in the nervous system. So the balance between being overexcited and underexcited. If we're always flopped out on the couch, totally horizontally relaxed, that could be problematic. If we're always excited and stressed, then overexcited, that can be a problem as well. So life is about balance, and adaptogens help that seesaw effect between the balance of the two. Relaxing and nervines are herbs that I would generally use because they are soothing, relaxing, and as I said, Dr. Clare will be talking more about the kind of psychological upsets that women experience, which are very much tied in with the physical. Bitters to help liver, help digestion, help, all of that ties in with hormone health in a kind of a secondary or roundabout way. So very important as well. It's important to keep the bowel moving. It is important to kind of, support the liver as well. So this is kind of maybe the foundation I was thinking, or that's what I was thinking of yesterday. Anyway, you might talk to me tomorrow on it might be slightly changed. But along with these categories, we also add in things that are kind of suitable for the individual. So that might be, if the blood pressure is kind of mildly creeping up, we might use herbs to help to bring it down again. And we might use herbs for cholesterol management, kind of protective herbs for the heart. Hawthorn is a lovely heart tonic, as I often call it. So kind of helps the heart work a little bit better. Anxiolytic, for stress and anxiety, pain management, joint aches and things, uplifting, anti-inflammatory, endocrine support, such as thyroid, and bone health support. So they are just kind of examples that I could come up with yesterday. But so what are the physical symptoms of menopause? I've mentioned quite a few of them. There are more, and in general, I've been about 12 years in practice at this point, and I've yet to meet someone who gets all of them. I guess that's one of the good news. But it is quite common that women experience 2 or 3 or 4 of them, and some women, as I said earlier, none at all. So, but these are some of the signs and symptoms of menopause. Menopause, menstrual changes, that involves frequency, quantity, quality. They can be irregular. It's quite common that women get like quite heavy bleeds before they stop. So they can experience what's sometimes referred to as flooding. Night sweats, usually at nighttime, but can also happen at daytime. But they can be experienced worse at nighttime because women are kind of the quiet time of the day. The hormone fluctuations can vary a bit at nighttime as well. You're warm in bed. You might be wearing synthetic kind of sleepwear. So there are kind of a number of reasons for why that might happen. Sometimes the mind gets active at nighttime. We get more anxious about what's happening tomorrow, what happened yesterday. And interestingly enough, not only do we sometimes get hot flushes and sweating, we also, for some women, they get cold flushing as well. And this can happen, like you sweat in bed, you get hot, and then you get cold after. So it's almost like the thermostat is kind of re-regulating itself. So fatigue is another one, sleep disturbance, you know, and I know Dr. Clare will be talking about that later on, so we won't go too much into these things because it's a short day. But brain fog, memory problems, muscle aches and pains, joint aches and pains. This can be due to reduced estrogen, wear and tear, dryness, vaginal dryness, which reduces due to reduced wall thickness and elasticity. This can lead to discomfort during intercourse. It can also lead to, kind of aggravate or make you more susceptible to infection or itching. This can also impact libido. So you might find that there's a change in libido. Some women kind of find that the libido drops, or the women find that they feel like it gets empowered. They find that it increases, and that may be to do with the transition of role as a woman, as a mother, as a daughter, as a partner. There's dry skin and dry hair that can lead to hair loss or hair thinning, migraines, headaches, which can stay the same. Like if you had been prone to headaches and migraines before, they can stay the same for about 30 to 50% of women, I think, continuing through menopause. But for some women, they get better, and for other women, they actually can get a bit worse. Bladder problems are quite common as well, either be it incontinence, frequency, urgency, pain on passing, thyroid disorders, be it overactive or underactive, with underactive being more common. Autoimmune can start to show its head, so weight and shape changes, reduction in glucose tolerance, water retention, and then the nervous system and cardiovascular health. So we talked about cholesterol and heart health, blood pressure, and as I said, Dr. Clare will be speaking more about the anxiety, depression, the ups and downs of kind of the emotional side of menopause. So these look kind of all separated, and this is kind of, but essentially they all kind of feed into each other. So like if you're having hot flushes and night sweats, you're more likely to sleep worse, you're more likely then to have brain fog, then you're more likely to feel like you have memory problems or experience memory problems. That might lead to muscle aches and pains, and aggravation of headaches or migraines because of tension leading into headaches. Again, vaginal dryness might lead to kind of feeling upset and feeling, kind of anxiety and concerns. Same with hair thinning and hair loss. Blood sugar balance can have an impact on hair and joint health, and so like there's a huge amount of interconnection. So that's why this is a complex phase of life, and that's one of the reasons why I kind of went into herbal medicine, was I like that complexity of the plants to work with us as complex human beings. So having said that, I'll just briefly, the hot flushes and sweating are probably the most commonly presented symptom. So they're not always menopause related, they can be adrenal related, stress related. There can be a number of reasons for why they happen. And it can happen that women go through the menopause and they're kind of completely, they have no period for a year, and then 2 or 5 or 10 years later, they're still getting hot flushes and sweating. It is likely that this is due to other causes, that is not menopause or sex hormone related. Hot flushes and sweating, as I said before, can be worse at nighttime, and they can increase with fatigue or stress, you know, so that's that kind of connectivity that I was talking about. Wearing light, loose fitted and breathable clothing can help. Also wearing layered clothing, so you can take off layers, put on layers, you know, having a fan to, you know, kind of use in your handbag that you can pull out, or having a leaflet or a booklet that you can kind of, that's a little bit kind of, you know, kind of hard paper based that you can pull out and use as a fan. Having light duvet, quilt, or blankets in bed, you know, or using layers in bed can also help, you know, or changing the duvets depending on whether it's winter and summer, you know, if you're not doing that already, can help as well. So you wear a really light duvet in the summer and heavier one in the winter. Keeping low room temperature can help. Minimizing spicy food, hot foods, drinks, or alcohol. You know, so sometimes women find that if they're drinking a hot cup of tea, that can cause a kind of a flush. And often it feels like that kind of central kind of, like, it's like the fire inside us kind of gets switched on, you know. And maybe that's what happens, because often women find that they get quite empowered after, and, you know, they kind of, yeah, they find that they are more, sometimes women get more outspoken, and they're more kind of, they don't take any nonsense, and, you know, so they are kind of other things that have been reported to me by women who have experienced menopause. So stress reduction can help. Exercise, particularly exercise outside, can help because it's cool. You're getting cooled down as you're exercising. Obviously, that mightn't be appropriate if it's a really warm and sunny day, like they are promising today in Galway. But that looks pretty nice. The yoga on the beachfront, I thought that looked nice. That looks like the cool sea air. It's also nice to be with the sea, because I quite like it, because it's like it's breathing as well. It's kind of, when the waves come in and out, it's like it's breathing with us, you know. So just a couple of plants. I picked out just a handful of plants just to briefly talk about with you. As I said, there are loads of herbs that could potentially work, but it needs to be kind of assessed what herb might be most appropriate for what your experience on an individual basis. So common sage. Sage is probably one of the most popular herb for menopause and for hot flushing or sweating in particular. It's readily available around, and it's often the herbs that women mention to me that's what they've been trying, or that's what they have taken. For some women it works really well. For other women it may be too drying, and generally I would always use it mixed in with other herbs personally. So we used the leaf that's sage from my garden this morning. I managed to hop out just before I came in and take a quick picture. I figured that was the best I could do, because it just looks so pretty at the moment with all its herbal flowers. So studies have shown that the use of extracts of sage can reduce menopausal symptoms, including hot flushes, night sweats, heart palpitations, muscle and joint pain, anxiety, panic, fatigue, and concentration, and more. So it has quite a broad effect. But one of the main reasons for it is that it's quite drying. It reduces that sweating effect. But that's only if it's taken cold. Interestingly enough, if you drink a hot cup of sage tea, it can actually make you sweat. And it can be really good for infections because of that. It helps you kind of sweat out the infections. It's also a bitter. It helps your digestion and your liver. It also has antioxidant effects, so that can protect our vessels. It can, you know, it helps with free radical exposure. Red clover, or Trifolium pratense, is we use the flower heads that are also really pretty and purple. They are found widely around Ireland and are also very common to be used for menopause, and can be found in many places for that effect. They are essentially cooling. They are rich in what what in chemical constituents called isoflavones, which have that phytoestrogenic or plant estrogenic effect that I spoke to you about earlier. It has a bit of protective effect for the bones due to containing daidzein, I can't pronounce that now, and those constituents that I can't pronounce, coumestrol and hormone is probably as close as I can say it. So it helps to build bone density and bone health. It's also a lymphatic, so sometimes women feel that they feel bloated, and sometimes a bit they describe it as I'm feeling a bit puffy. So having red clover can help with that feeling. It's quite nutritious as well. And, Canadis and his colleagues carried out a systematic review of 10 studies that kind of covered 910 peri and postmenopausal women. And that showed that there was also cholesterol reducing effect by, through using red clover. And another study highlighted that highlighted the complexity of the herbs that I spoke about earlier. It mightn't just be the isoflavones that are having the estrogen effect on the skeletal muscles, but it might also be kind of other constituents at play, this is also, I often say that in relation to turmeric as well. Turmeric is quite a fashionable herb, and it's very common that people talk about the curcumin in it, and it's isolated to the curcumin, which is believed to be the active ingredient. But I think that turmeric has other active ingredients, and so sometimes using the whole plant is a better option. Dandelion, we use the root and the leaf. The leaf is cooling. It's what it can be called a potassium-sparing diuretic. It has a bitter effect, so it stimulates your digestion, your liver. It's very nutritious. It has vitamin B, C, D, calcium, potassium, a bit of magnesium, I think, as well. The young leaves can be used in salads or steamed or added to stews and soups. Once it gets beyond that, the older leaves can be quite bitter. So, yeah, I generally recommend the younger leaves for tastability. Root. The root is cooling, bitter, so again, helps the liver, often used for constipation, keeping the bowel going, aids digestion and fat, kind of metabolism, so cholesterol management. It increases bile flow and digestive enzymes, so keeps the bowel moving, as I said. It helps to normalize blood sugar, and it can enhance hormone excretion because you want to kind of keep everything moving when you're going through menopause. Both the leaf and the root have also been shown to reduce cholesterol and offer protective effect against oxidative stress, which is good for cardiovascular health. So lady's mantle or Alchemilla vulgaris, we use the leaf of that. It's a common plant in Ireland. It looks very pretty. It has these water droplets in the morning. It's cold and dry by nature, so cooling for all those hot flushes and the sweating. It's drying for that. It also acts as a uterine tonic. It can help to regulate the cycles a little bit, but only if you're not that far. So, like if you are far enough into the menopause that it is going to happen, the herbs won't stop it. But sometimes I have found that if the women are just starting and it maybe was a little bit premature, we've been able to bring them back to regularity. So nervine and anxiolytic herbs, astringent, so it helps with kind of uterine tone. It can help with if you're prone to loose stool. It can help with kind of toning the uterus. So if there's a mild kind of prolapse, and then finally it contains flavonoids, which can help reduce capillary permeability and protect against degradation of connective and elastic tissue. So that's quite good for the vessel health and our heart health and other things. And can be quite good for heavy bleeds, when when there is or kind of if there's thinning of the skin, for like what's called atrophy. Dr. Clare has formulated a blend that kind of covers a lot of these herbs. There's sage, there's red clover, there's dandelion root in there, but also other herbs such as angelica or dangui, called Angelica sinensis, and that has kind of painkilling effect, antispasmodic, it's cardiotonic, helps the stress and anxiety, is very nourishing. It's what we sometimes refer to as a blood tonic, when you're feeling a bit deficient in herbal medicine energetically, we sometimes talk about blood tonics. White peony can also help with period cramps and pain. It's anti-inflammatory, it's antispasmodic, it can help with focus, it can help with relaxation, it can support the liver. Lavender, I think most people are familiar with. It's relaxing, it's antispasmodic, it can be excellent for digestive upsets and bloating and belching. It's uplifting, it's relaxing. I mean, it's lovely. And if you like the smell of lavender, even better. If you don't like it, then probably it's not the herb to be chosen for you. But in a blend, you won't even notice it. Bacopa is what we talked about, that adaptogenic effect, that seesaw effect. So it helps with anxiety and kind of being overstressed or over relaxed. Or if you've been driving on stress for quite long, it kind of helps to tilt that balance back into place. It's antispasmodic, it's anti-inflammatory and astringent, so it helps to tighten up the tissues a little bit. Siberian ginseng is very different from what's called ginseng in general. It's more relaxing. Ginseng is quite stimulating. So I often refer to it as a neutral adaptogen. You can also have herbs such as ashwagandha, which is a relaxing adaptogen, and while the kind of ginseng is stimulating adaptogen. So they're not actually related, but they just happen to have the same common name. That's why it's important to use Latin names as much as is possible to make sure that you're using the right herb. Siberian ginseng can also reduce cholesterol, is anti-inflammatory, helps the immune system, so it's good to have strong immune system while you're going through the menopause, because, if we can prevent you getting too many colds and flus, that would be good as well. Bladderwrack or fucus vesiculosus is used for hormone support, and because underactive thyroid is quite common for or kind of reduction in it might still be within the so-called recommended range, but it might be a little bit on the lower side. We've added the bladderwrack just to kind of support the thyroid health. It's just added in small amounts. So, I mean, this is the woman's blend there. We have it in different sizes. There's kind of big bottles, small bottles. So that's quite handy to know about. That might be a good place to start. Try that for 3 or 6 weeks. Obviously making sure that this is what's happening and that there isn't something else that's to be concerned about. But if you can try that first, try for, as I say, 3 to 6 weeks. If it's not working, then come and talk to us. General recommendations. I mean, this is kind of stuff that I'm sure you'll hear about throughout the day, so I don't want to go into any detail about it, but just to highlight the importance of good nutrition and digestion, to make sure you get enough fiber, and essential fatty acids and magnesium, that you're getting good nutrition, that you're being nourished. And I believe Linda will be talking to you hopefully more about that later on, so I won't go into any detail. Stress management, meditation, singing, laughing, all helps. Aim for restful sleep whenever possible. This might, if you're going through a real upheave with your sleep, you might need a little rest in the afternoon. Aim for good work-life balance to keep that kind of that you're not overdraining yourself. Having goals and things to look forward to can be helpful. Exercising, as I said, outside can be helpful. Spending time outside every day, even just kind of pottering around in the garden if you have a garden, or on the balcony if you have a balcony, or going for a walk in the local woods or, local area, or just going and finding a tree to sit under can be nice. And don't forget to look for laughter in life, you know, very important. Just as a final thing, just vitamin D is really, really important. You could nearly say it's like a hormone precursor as well as a vitamin, or even more so than just a vitamin. It's very important for our health for a variety of reasons, including assisting with intestinal absorption of calcium. It helps bone health, it supports immune system, it helps skeletal muscle strength, cardiovascular health, it helps to normalize insulin. You know, I mean, there's a lot to be said for that. Vitamin D deficiency even can manifest as muscle and joint pains or bone pains. So, you know, making sure that you're not vitamin D deficient is very important. And as we get more experienced in life, or as we progress through life, our skin matures, and you know, it reduces some of its ability to synthesize the vitamin D from the UV light. So, you know, just to have that highlighted as well. So this is again why it's good to go out on a sunny day. Obviously don't get sunburned, but expose your skin to a bit of sunshine, you know, and take supplements if that's not topping enough. And you might have to get a vitamin D test. So that's kind of me done for the day. Thank you for tuning in today, I would like to say, and I would like to celebrate the opening of the discussion regarding menopause. I think it's very important for us having this discussion. Long may it last and continue, that we keep talking about menopause and our periods and what's normal and what's not, and when should I have it checked and when should I not, and you know, this is what I'm experiencing, what's you experiencing, and kind of sharing our stories. It'll make it, we might be able to help someone who doesn't either realize that something that they're experiencing isn't what's kind of maybe not the recommended thing, or just also it might just be supportive of just kind of sharing our stories. I hope this will support and help women who are going through this transition in life and may need support going through it. So I know that, yeah, so I have some questions. Yeah, what do you recommend for dry eyes? Yeah, dry eyes are part of all this dryness that happens. I liked, when I was studying, I liked that there was somebody who explained it, that we're going from the wet phase of life to the dry phase of life. You know, is that transition from wet to dry. When we're younger, we get, you know, like teenagers get spots and kids get mucus coming anywhere and everywhere, so that they're in the wet phase of life, while as we transition into the dry phase of life, we start to experience the vaginal dryness, the dry hair, the dry eyes, and etc. For dry eyes, I would probably recommend essential fatty acids. Flax seeds can be helpful, or fish oils can be helpful as well. It can be nice to use oil around the eyes. So like when you're using moisturizer, I quite like coconut oil, and you can, don't put it in your eye obviously, but kind of put it around the eye, and then putting like chamomile tea bags on the eyes can be quite soothing as well. And then I know there are eye drops available. I think there are eye drops available in Evergreen, if I remember correctly, that can be used as well. So they would be kind of things that come to my mind at the moment. But it is also about that kind of general moistening effect. So that's why the internal oils, internal essential fatty acids, eating fish, you know, which is rich in essential fatty acids, avocados, nuts and seeds, and that's, you know, including the flax seeds. So 1 or 2 teaspoons of them a day can help with that a little bit as well. So yeah, obviously making sure that it's all been checked out, etc. I have been waking with burning feet. Any recommendations? Yeah, burning feet can happen as well. It's that kind of heat sensation that kind of, it's like the thermostat goes a bit askew. So sometimes you can feel cold up here and warm down there, or warm hands and you know, cold hands and warm here, like it kind of goes to different locations. I would suggest circulatory herbs. Hawthorn might be good. Cooling herbs, you know, magnesium, and then just sometimes having a cold bath, you know, or doing hot and cold treatments on the feet can be helpful. That can be done at night time to kind of stimulate the circulation. And this is assuming there's no skin rash or anything like that. Yeah. Crawling feeling on my face, sore gums, teeth, on, off, is a question. So crawling feeling on my face, sore gums and teeth, on and off. Yeah, I'm assuming you've had the sore gums and teeth checked. There's no gum disease or anything like that. I would think that look, it's hard to say in regards to that without really knowing what's happening. Yeah, it's kind of hard to say. I don't know. You could try a bit of chamomile. You know, it's relaxing, it's soothing, it's anti-inflammatory. But yeah, it might be good to just give us a call. We can talk to you about that a bit more. Yeah. Yeah, and then what about vaginal dryness? Yeah, I talked about vaginal dryness earlier a little bit, only touched base on it. We do have a cream here in the shop, like this, which is for vaginal dryness, which can be applied topically and inside the labia. We also have pessaries. I don't know, I don't have them here with me right at this moment, but we do have pessaries that can be inserted into the vagina, and you know, you kind of insert one at night and lie down. Wear a panty liner because it can seep out a little bit just to protect your underwear. But that can help with the vaginal dryness as well. Yeah, I think Cara, did you say it's time? I think I'm handing over to Breda, who's going to be talking about HRTs and medication options with research-based information. So, you know, her work seems very interesting. So I'm looking forward to her talk and what she's doing. She has this project going to support women through menopause. Sounds very interesting. I'm looking forward to hearing Breda speak. Excellent.
Thanks, Lara. I'm just waiting, Ruth, for Lara to remove her slides. Thank you. Good morning, everybody. Just going to turn this off here. Thanks, Lara. That was really informative. Really informative. Good morning, everybody. I hope everybody can hear me there. Can you hear me, Ruth? I'll just do a check on the sound system, if that's okay. Okay, great, great. Lovely to be here with everybody. My name is Breda Birmingham. I'm from Waterford. I'm a menopause researcher, former midwife, and a public health nurse. I'm just going to pull up my slides now before this presentation. and I am presently a midlife and menopausal women's coach. Just going to pop my screen, just get it sorted here. Now, I hope everybody can hear me there. So my own story is that I was a midwife and a public health nurse for quite a number of years. And after I had my fourth baby, I ended up staying at home as a full-time mum, doing a little bit of part-time work for almost 10 years. And I suppose my involvement in menopause started when I returned to full-time education in 2015. I went back and I completed a psychology degree in 2018, and I decided to review the research on midlife women during this time. And what was very, very interesting was that I discovered that we're quite invisible really inside in the academic world. There's very little research done on women between the ages of 40 and 65. And what I've discovered is the repercussions of that are only emerging now actually into the public domain when it comes to well-being, health, leadership capacities, confidence and courage. This is all emerging, and in particular in the UK, because the UK are leading the world globally when it comes to menopause education, and they're leading the way when it comes to midlife women actually stepping into an arena, the menopause arena, which has been occupied by male doctors and professors, you know, doing the research and doing the talks around menopause for decades. So it's women's voices are coming into this arena in the UK, and the UK are leading the world globally when it comes to bringing menopause into the public domain, normalizing the discourse, normalizing the conversation. And this is where we really need to go in Ireland also. And a huge thanks to Joe Duffy, who has given us this magnificent gift in having menopause talked about for 9 days on the national airwaves, because I've been working in menopause land, as I call it, for over 2 years, and I've been advocating to try and bring menopause to the attention of, I've written to the Citizens Assembly, the National Women's Council of Ireland, the Department of Health, and I was involved with many others here in Ireland, including Sally Ann from the Irish Menopause, with the Women's Task Force. And just pre-COVID, we had a fantastic day in the Department of Health with different groups, whereby they decided then that menopause was going to be chosen as one of the most important areas to focus on throughout 2020 and 2021. Now, unfortunately, COVID arrived, and as a result of that, menopause kind of was sidelined a little bit. But thanks to Joe Duffy, it's coming back into the public sphere again. And we need to bring it out. We need to talk about it, because it's only when we look at taboo subjects, the silence feeds an awful lot of the fear. And as I will be sharing here in the slides, I will be sharing my own research. And I went back, I completed a psychology degree in 2018. And then in 2019, I went back to Maynooth University, and I decided to further investigate the cultural and the sociological, societal impacts of menopause on women and on society and on families, on relationships. And it's interesting what the findings have been quite interesting. So that's my own background. I'm in the space because I see there's a massive injustice here. There's a massive injustice in the way, number one, menopause has been framed. Number two, the silence and the taboo around it. Because I firmly believe if we can remove the taboo and bring the conversation mainstream, just like we do pregnancy and preconceptual care, we can actually reframe it, and we can empower and enable women to manage it quite proactively. So following my psychology degree, I decided to set up the Midlife Women Rock cafes here in Waterford City, and I got great support from Social Entrepreneurs Ireland. I was in their academy in 2019, and here in Waterford, Grow HQ, Michael Kelly enabled me to have the first meeting here, and then that was followed by monthly meetings that were set up in the Waterford Health Park here in Waterford City, thanks to Dr. Mark Rowe and Dr. Ita Craven. We were able to meet women, groups of women were able to get together, and I was providing information. We were sharing stories, and we were challenging a lot of the stereotypes around menopause. And this is part of the problem. There are massive myths and negative stereotypes that are hanging over us from the past, and they need to be busted, for want of a better word. And this is why we really need to bring it into the public domain. So I set up the cafes. Originally, we were meeting here in Waterford. With COVID last September, I decided to move online, and I was skeptical initially, but what's actually happened as a result of going on to Zoom, I have women now coming and joining in monthly with the conversations from all over Ireland. And this past week, I ran 3 different cafes because of the numbers of women who are interested in finding out more about this stage in life. You see, menopause has been hidden in society. It's been shrouded in silence for decades and decades. And this is not just in Ireland, this is globally. You know, we're the invisible women, and the value around women post their fertile years needs to be challenged hugely. And this is where this midlife movement in the UK, which is gaining massive traction, is very, very significant at the moment, what's actually happening in the UK, which I will talk about as I move on. So I set up the cafes, and out of the cafes then emerged 6-week courses for women. This is due to demand. Women they wanted to know more. They wanted more information. They wanted more education around not only the physical changes, but there are deep emotional and psychological changes that are actually occurring to us as we move through our perimenopause and menopausal years. Then in the last 6-7 months, I'm doing one-to-one coaching, because some women prefer to sit down and have a chat for an hour. Usually we go through the symptom lists on what symptoms that they may be experiencing. We talk about what's actually happening in their lives at the moment, and we make a plan. We set out a plan, and it's amazing. What I love working with women on a one-to-one basis, because they come in with a lot of fear and a lot of anxiety, and within a 1-hour session, there's massive relief, because they've started to understand not only menopause, but they're understanding themselves and what's actually happening to their bodies, what's actually happening to their minds. And that in itself is, it kind of depersonalizes menopause from who they are. So this guilt and blame, and I'm not able to cope. Why am I not coping? When I tell them that, you know, this is menopause, what you're feeling, what's going on at the minute it's all natural. It's a natural part of this transition, this very, very significant transition. And there is so much that can be done to help to minimize or eradicate symptoms. So that is where I stand in the world of menopause in Ireland, catapulted into the space. When I went back to college in 2015, I never thought I'd end up working in this space, but this is where I am, and I have to say I absolutely love it. It's a very exciting time to be working in the midlife women and menopause space. And my own mission is to empower and to change this overwhelmingly negative cultural and societal paradigm around midlife women, and in particular menopause, because I've discovered that it's this framing and this story that is leading to an awful lot of the symptomology. We are afraid. Women do not want to be in menopause. There is shame about being in menopause. There is denial about being in menopause. So we need to change the framing of menopause. And there, again, there's a big movement within the UK. There are groups like, you know, the midlife, behind the woman. That's one of them. There's huge movements in the UK that are trying to reframe how menopause is positioned in society. If we stay silent, nothing is going to change. So it's so important that it has to be brought out into the public domain. I've heard some people comment that they were uncomfortable hearing Jo Duffy, but this is women's reality. The stories we heard there, that's the reality for many, many women as we're moving through perimenopause and menopause. Prior to 2018, when I started researching menopause, I had never heard the word perimenopause. Never heard it. I wondered why I hadn't heard it. The symptom list, which I will show you shortly, I had, apart from 3 or 4 that I'd heard of, I never heard that there could be 34 or 35 different symptoms associated with it. So there's the lack of education and in information is scandalous where I'm concerned. I mean, every woman on the planet is going through menopause, not unlike pregnancy and childbirth, yet the supports out there are minimal. And I go back, our eldest is 27, and I go back to the information that was even available then around childbirth. Compare that to the masses of information around pregnancy, childbirth, preconceptual care, in vitro fertilization, and yet there's nothing over here in the space where we are as midlife women and menopausal women. And the change is going to occur by us, because how it started in the UK, it's grassroots women leaders are stepping into this space. I was very fortunate to attend the first menopause conference, which occurred actually 2 years ago this month in the UK. Meg Matthews was the organizer, and Dr. Louise Newson was the medical lead, let's say, on that particular day. It was the first conference, as I said, for women, organized by women. And there were 300 women in the room on that particular day. And Meg early on referred to the fact that the majority of us that attended on our own. And the reason we were attending on our own back then 2 years ago was because she was saying that, you know, this is taboo. This is what happens when a subject has been allowed remain taboo and remain silent for so long. So we came that day, but it was the most energetic and energizing day because she started that mission. She was on a mission to open up the conversation. And herself and Dr. Louise Newson, Diane Danzebrink, they started this movement. And it has just, you know, proliferated hugely within the UK. It's a menopausal movement, but it's also a midlife women movement. Midlife women are accessing their agency and their voice like never before, and they're no longer invisible. And this is the ripple effect is coming from the UK, and it's going to hopefully proliferate within Ireland, because America are following suit. I noticed looking at some of the conversations, they're looking for more information. They're trying to empower women to understand that, you know, that there is help out there. We don't have to suffer unnecessarily. I did a lot of work about and around the power of language when I was researching for my master's, and I looked at the way, again, these are hidden issues in society. There's structures and systems in place in society which we're unconscious that they're actually there, but they are there. And if we look at the language that has been ascribed to women reaching the end of their fertile years, invisible, undervalued, devaluation or you know, devalued, degeneration, crisis, loss, mad, crazy, bitchy, and confidence dips. Of course, our confidence is going to dip, because this is the societal and the cultural norm. The social norms around menopause are all associated with these words. And when I speak to women, initially when I started the cafes and women would come in, this is the story, these are the words, and this is the language they were using. But then only in 2015, down in Monash University in Australia, researchers started to ask, surely there must be something positive around this stage in life for women. And that has kind of opened the door then to an increasing amount of research looking at the positives of this life stage. You know, it's not all negative, but it has been framed and it's been portrayed in this way for decades and decades. And my own interest was on finding out why. How did menopause become framed in this particular light? That was my own interest. Menopause, as Lara was saying earlier, it's not a disease, it's a process. It's a highly significant one, which has not been it hasn't been what's the word I'm looking for? Highlighted. The significance of it has not been highlighted. For me, the way I look at it, it's another life transition, like puberty. And for anyone that has teenagers, puberty takes quite a number of years. There are hormonal fluctuations. The hormones are entering the body, and as we move through our perimenopause, menopausal years, our hormones are declining. And we have mental, psychological, and emotional shifts. I mean, you know, teenagers one day they'll love you, the next day they'll be banging the door. There'll be the mood swings, changes in their skin. So that if we can use the analogy of puberty when we're talking about menopause, as opposed to thinking, you know, you're going to be over it in a year. And I also love the analogy of the caterpillar to the butterfly, because what women need to realize as well is we're changing as women. We change as we're moving through those menopausal years. And we're changing for the better, might I add. And I will talk about that a little bit more in another slide. So what has brought us here today to where we are in Irish society, where there has been very, very little talk and public discourse around it, there's been no information, no preparation, no education. And these are the three factors that are feeding into the fact that so many women find themselves in crisis when they are arriving into perimenopause. Many women tell me that they hit the wall. They've hit this wall. They can't go on any further. But you know, you're hitting the wall because your hormones have dramatically declined. When our ovaries are no longer producing estrogen and progesterone, for many of us, the adrenal glands take over and they start producing amounts of estrogen and progesterone. However, there is a certain percentage of women where the adrenal glands do not have any estrogen present. And from working with women, those women who have access to hormone replacement therapy, they will find if the ovaries are no longer producing estrogen and progesterone, once they start taking hormone replacement, within 2 or 3 days, it's like wow, the impact can be very, very fast and very, very powerful. So Lara had covered a lot about the hormonal fluctuations. I will be talking about HRT further on in the slides, but for women in crisis, or for women that I meet that hit the wall, HRT is a very good treatment option for this stage in life. Now, my own master's is titled Silence, Taboo and Midlife Women. It's available on Google Scholar. If you go into Google Scholar and just type it in, and you will find it. And it's long, but if you go into the women's voices section, I think is the most interesting. Women talking about the silence and women talking about having come to the cafes and being given information and provided with, you know, different pathways of managing menopause, and how having that education, having that information, how that then changes the narrative for them. Just very, very powerful. So what came up in my own master's was fear, shame, denial, and stigma. These were the themes that came out again and again. I interviewed 20 women on their experiences and understanding of menopause in Ireland. And that was last year in 2020. I discovered there's a paradox here. The silence is feeding all of this fear, shame, denial. But if we remove that silence, if we can take away the silence and we spotlight menopause, what is it? What is perimenopause? You know, why is it happening to women? Understand the hormonal fluctuations, understand the emotional and the psychological shifts that are actually happening to us. That we can actually reduce this fear, we can reduce the shame, you know, we can reduce the denial. Shame is very interesting. I love the work of Brené Brown, psychologist and social scientist. Anywhere that shame raises or lurks its head, there is an association with silencing, and there's an association with conformity. And for too long, women, we've stayed quiet. We haven't decided not to talk about this time in life. But like, as I said, I went looking to find out where it all started, why, and we have to go back to the 1960s to find out where women's voices were shut down and where we decided not to speak. But I believe that we have to become the generation to make menopause matter. And I work between the UK and Ireland, and I've been following the menopausal movement in the UK over the last 2 years. And, you know, this movement is growing. It's getting bigger and bigger. There are more and more women coming into the space. And this is about women empowering other women. This is what's actually happening in the UK. It's ordinary everyday women are coming in, and they're coming into work in this space. And as a result, they're actually empowering other women. Stories are being shared. The media, The Guardian and The Observer newspapers, great credit to the journalists involved there, because in the last 2 months, there wasn't a week that they didn't cover something on menopause. And The Guardian every month has a section on menopause, bringing it into the social domain. And this is why, you know, there's nothing to be, you don't need to be ashamed about menopause. This is where we have to move to. It's like Meg Matthews' book, she called the title of her book was The New Hot, right? Taking on the menopause with attitude and style. And this is where the language, I love the title of the book, because she's moving massively away from this old negative, degenerative language that has been used around menopausal women for too long, which has not helped us, and that has to go. So this is the article from The Observer before the Channel 4 documentary, which many of you may have seen. Davina McCall, Kate Muir, Dr. Louise Newson, and this is what's actually happening. There's the rise of menopause power, and the celebrities in the UK have joined the movement, and that's why it's moving at a kind of a faster pace. And Channel 4 getting a documentary and getting it, Channel 4 as well, they're leading the way when it comes to the media in the UK in supporting this movement towards bringing menopause into the public domain, helping women realise that, you know, hey, there's no need to be afraid of being menopausal. There is no need to be in denial of being in menopause. There's no need to be ashamed of being in menopause. And that story, that has got to go. But Meg Matthews, Louise Newson, Carl Vorderman, Lorraine Kelly, quite a number of other celebrities are coming in. They're talking about their own story. They're sharing their own story. And this is what happened. These were my symptoms. This is the avenue I search for. And what's great is if anyone's following, either on Instagram or on Facebook, or if you're following what's going on in the UK, they are ahead of us. They're ahead of us when it comes to information. And I feel we do need to catch up. I'm just going to quickly go through this slide. I put it up here to remind myself to tell you that, you know, for women that do not realize they're in perimenopause, I didn't know I was I didn't know the word existed before 2018. For me, my own journey, I was perimenopausal. I did not know I was perimenopausal. My symptoms, my final year when I was studying psychology, I started putting on quite a lot of weight. I put it down to the fact that I was spending a lot of time in the library. I was doing assignments. I was doing exams. So I was drinking lots of cups of tea, eating lots of biscuits and cake. So I really didn't realize that, you know, that it was actually related to perimenopause until we were going on holidays. I remember May 2018, and I went to the wardrobe to pull out my clothes, my summer clothes. And when I took them out and I was putting on some shirts and shorts, absolutely nothing fitted me, which was this fluid retention that I'd had all over. And funnily enough, when I was pregnant, with my 4 children, I had put on a fluid retention was an issue for me then. But I suppose I was a bit distracted with study, but I didn't realize, and my periods were still quite regular. So there was nothing there to tell me that, oh, you know, you're actually inside in it. You're actually inside in perimenopause. And it wasn't until I saw the list of the symptoms that I realized, this is me, I'm in it. So it was weight gain and weight around the middle, in particular around the hips. And I can honestly say it took me 18 months, nearly 2 years to actually go back to my pre 2018 weight. So it is difficult to shift weight when it does creep up on one, if that's a symptom. Body odor. The other significant symptom I myself had was anger and rage, which I will talk about. I've got a slide here on it. So Lara, I think, covered very, very, very well all the different stages of perimenopause. The diagnosis, again, Lara had referred to that. The clinical symptoms when you're over 45 are so important. And if you're over 50, it's 12 consecutive months with no period. If you're under 50, it's 24 consecutive months. That differentiation is very important. Dr. Louise Newson believes that over 45, it's a waste of time having blood tests done. Under 45, yes, the follicle stimulating hormone and luteinizing hormone will be elevated, but the reason it's not really worth having the bloods done post 45 is because during the day our hormones are going to be moving up and down all the time anyway. So you'd have to take 4 blood tests in a day to get an accurate reading. I put this up here, ladies, because when I saw this for the first time, I could honestly say I nearly fell over when I saw the amount of symptoms, and I wondered why nobody had told me. Why had I not? Why had I gone through my nurse training, midwifery training, public health nurse training, and nobody had mentioned menopause? And this is where there's a massive injustice. We're being let down by the system by not understanding that these are all possible symptoms of menopause and perimenopause. And once women, when I work one-on-one, let's say with women, we usually start off with this, and the women tick off the amount, the number of symptoms they may have. And I think Lara touched on it. You know, when you're early perimenopause, your symptoms may be very different to when you're coming to the end of your perimenopausal years. So there's shifts happening, and it's the awareness though is key. And from working with women in the cafes, or from working with women on the one-to-one basis, once women are aware, they're then kind of they've got control over, you know, how am I going to then navigate? And it's a choice about how and what am I going to do? What am I going to use here? What's going to help me to get through these years? And this is so, so important. Statistics, I'm a lover of statistics myself, and just to fly through some here, the average age in Ireland and the UK is 51, 52. 600,000 women in Ireland. Dr. Deirdre Lundy had mentioned this. I had my own research was 400,000, but she would have more up-to-date findings. She said between early menopause, perimenopause, and women in menopause, there are 600,000 in Ireland, 13 million in the UK, 60 million in the USA, 1 in 1,000 under 50 and 1 in 10,000 under 40. Now, why the midlife movement is changing? Why is this happening? You may ask. Today, demographically, we've got the largest cohort of educated and economically independent women moving into their 50s and moving through their 50s. We have this than ever before in history, and they believe that by 2030, the world population of menopausal women is going to reach 1.2 billion, with 47 million women coming into this space every year. So we're going to be part of quite a significant, numbers wise, we're going to be quite significant. Forbes, now this came out in, I think it was February this year. Forbes estimate that the economic cost annually of menopause is $870 billion. That's the global economic cost of menopause. And we must remember that the workplace, more and more women, are navigating work and navigating perimenopause and menopause. And statistics are important when policies and policy change is when one wants to bring about or try to impact policy change. And I feel with Forbes talking about the economic cost of it, that something has to shift in order to support women and to support retention of women in the workplace. Again, 10% of workplaces in the UK have menopause policies, and there's been an awful lot of work done, to bring it even to that level. And that's over 2 years, because I've been involved in a conference there. I've many friends working in the menopause space, but they're seeing it slowly, but it is happening. It is occurring. And again, it's about women using their voice and using their agency to ensure that we are supported through these years. There's a lot of information on this, and this is the only slide which I did put a lot of information. I've mentioned the first about we're the largest demographic now, so this is interesting. The movement in the UK is led by, as I mentioned earlier as well, it's grassroots women leaders that are coming into the space. The shame and silencing, then I was interested in trying to find out, where did it all start? What happened that silenced women? Why is it that we do not talk about menopause? And I went back to the 1960s and I discovered this Dr. Robert Wilson and his best-selling book, Feminine Forever. And for 20 years, throughout the 60s, 70s, and the 80s, he traveled across America. He was the darling of the media, and he was peddling this book. And in this book, he referred to women who reached the end of their fertile years as withered, crippled castrates who had lost their femininity and lost their sexuality. And he said he had the answer to ensure that, that they wouldn't become withered, crippled castrates, or that they wouldn't lose their femininity, or they wouldn't lose their sexuality. So he was telling, and the book, and he himself, he was advocating for very large doses of equine, which is horse urine, HRT, at the time. Now, with this narrative that talking and referring to menopausal women in this way, I often wondered how he got away with it. Why was it that nobody spoke up and says, why are you referring to women? And what I kind of discovered is that, again, it's around the women's voice and it's around women's agency at the time. Within the medical profession, I discovered that he was being challenged, but the numbers were very, very small in using this and like, let's say, using women, using his narrative and using that rhetoric to tell women that, you know, you're gone past your best, you're no longer, you're a crippled castrate or with a crippled castrate. And that has remained, I've discovered, in the psyche. That's coming down, because in the 1980s, Germaine Greer and Dr. Gail Sheedy came onto the menopausal space, and Germaine Greer is a feminist, and she challenged everything that he was saying, Robert Wilson. But what was also interesting in the 80s was that after Dr. Robert Wilson died, it was discovered that he was paid huge amounts of money by a pharmaceutical company to promote that equine HRT, and was to promote huge high doses of it at the time. So medicalization of menopause is only part of the much bigger puzzle, as I say. Now, the big difference between the HRT that's available today, which I will be sharing on the slides here, and the HRT he was peddling is there. You know, there's masses. They're worlds apart. The hormone replacement therapy that's available today is made from yams, so it's plant-based. It's completely different. But what I was interested was the framing, what he was calling women, what he was referring to women. So who in the 60s and 70s would put their hand up and say, I'm a menopausal woman? Nobody. And that has continued in the psyche of women. So it's in removing that, and in women realizing that menopause is certainly not an ending. You know, it's actually, in many, many ways, it's it's the start of a quite an empowered period of women's lives in their 50s and 60s. I put this one up here because it, number one, it's the anger around the research and the fact that, you know, that there's been no education, no preparation, no information. And number two, it was the anger that I felt myself. It was one of the symptoms I had for about 9 months as I was moving through perimenopause. And if one is interested in finding out the significance of anger, Flash Count Diary, a book written by Dorothy Steinke in 2019, who went on a search to try and discover what menopause was all about. And she talks a lot about the power of anger, not to be afraid of anger. Anger, women in their middle years are angry for a reason. And, you know, it's not that we're bitchy, as somebody on the Joe Duffy said, that we become, irritable or irrational. That's not true at all, that there is a reason for the anger, which I do a talk on, or during the 6-week course, I go into in quite a lot of detail. Management pathways, 80% of women have symptoms. And really, it's all about, ladies, finding what works for you. I talk about these 4 dimensions of empowerment. Mindset shifts are huge. I do a lot of work about challenging women about how you feel and how you think about yourself as you arrive into perimenopause and menopause. Fear and anxiety are bedfellows, anger and depression. And Dr. Clare is going to talk more about those later on. Anxiety is one of the top 3 symptoms, and again, from the women I've worked with, shifting the mindset and challenging the fear around this time in life actually has a huge impact. The other, when I'm consulting with women, we talk about the importance of food, we talk about the importance of movement. Movement I've used myself hugely. It's the quickest way to change your mood is movement, and there's loads of emerging research there on the power of movement. And as we're moving through our middle years, we should actually be increasing our movement, but the key is to find something that you enjoy. It's not about going into the gym every day, you know, it's about finding something you really enjoy yourself, be that walking, running, cycling, tennis, dance, because it's about moving the energy in our body. You know, our bodies are made up of energy, and it's so important that we move that energy every day, move that body. Hormone, and then I'm going on here to talk about hormone replacement therapy. HRT has received a lot of bad press, I guess, when we look back over the years, and in particular, Dr. Robert Wilson and that story from Feminine Forever. And since then, there's been a number of large-scale studies, but the studies really haven't, from my own research, they haven't really benefited women. They've created an awful lot of confusion. They've created an awful lot of fear in women's lives. But so today, when we look at what is available for women today, and Dr. Louise Newson, my Menopause Doctor website, if somebody wants up-to-date, accurate information around hormone replacement therapy, I would highly recommend going to Louise's website, because she, again, within the medical community, she is being challenged on the fact that, you know, she's an advocate for women who, and there is a percentage of women who massively benefit from hormone replacement therapy, and there's more and more evidence around that. There's another cohort of women who may take hormone replacement therapy and it just does not suit them. There's another cohort of women and they prefer to go down the alternative route. The way I look at it, it's about, ladies, it's about empowering yourself. You find out what is going to suit you best. And that's the key. You find out. You have to go on the websites, start reading the books. The book I recommend is Meg Matthews' book, the new hot book that I was talking about earlier. This one, because it's very easy to understand, and it's written for everyday women, and she covers every aspect of the journey that we go through, available online and translated into, I think, six or seven different European languages. Meg's one, and it's become a bestseller in America also, that particular book. Another book, actually, as I'm just here, I'm going to recommend is Embracing Change by Dr. Harry Barry. So again, going back to the journey, when we talk about this journey and finding what is, you know, what's going to work best for us, because that's the reason menopause is complex, is that no two women are going to have present with the same set of symptoms, and no two women are going to have the same you know, management pathway. There's no template, and that's why it can be difficult to try and find what works. So with the movement in the UK, what they're looking at is it's about finding whatever you feel is going to work for you to manage your symptoms as you're moving through. What's so important as well is to understand that it's estrogen and progesterone are the hormones produced by the ovary, but cortisol and insulin, and they were the hormones for me, personally, cortisol and insulin, that I had to watch in my own perimenopause journey. And a lot of the time, I think they're underestimated the effect cortisol has, the stress hormone. Because if we can try and reduce that stress hormone, we can actually change. We can start to bring down a lot of our symptoms. Hormone replacement then is available. What's wonderful about bringing it into the public domain, and with Dr. Louise Newson, Dr. Naomi Potter in the UK, bringing it out and having the drug companies look at it, is that it's becoming available, hormone replacement. There was a time when you could only take it in tablet form, whereas today now you can take, there's gel, there's patch format, there's spray. And again, there's bioidentical and body identical. You'd see a lot of controversy there about this bioidentical and body identical, which I will speak about here. I think, have I got it here? Yes, body identical. So the body identical they're the synthetic plant-based, made from wild yams. They're close in nature to the hormones produced by our bodies. And in the UK, they're now available on the NHS. The bioidentical are compounded hormones not regulated or licensed in the UK. And there were centres in London that were producing the compounded hormones for years, and women were attending. They were attending these centres, but the regulatory body, they're backing the body identical. Now, the number of women in the UK that take hormone replacement therapy is 10%. From my own research here in Ireland, my 15% of the women that attend the cafes or have attended my courses or I work with them one-to-one, there'd be at least 15% of women using hormone replacement therapy. So whether you're taking herbs, whether you're using homeopathy, whether you've decided to hire a movement coach or dietitian in the UK now, there's menopausal dietitians, menopausal gym instructors, menopausal Pilates instructors. And what women are doing is they are investing in themselves. They're taking on, for example, last week I had a woman who is working with a menopausal Pilates instructor, 6-week course, deciding that she wants to understand her core, wants to understand the pelvic floor and the power of movement. The menopause dietitian, Nigel Denby, is hugely popular in the UK. Women are deciding again to invest in themselves and fully understand what is happening to them from the gut brain. There's a load of research on the brain and the gut and how that impacts us as we're moving through our menopausal years. So ladies, I just wanted to say it's about choice. It's about having that choice, but the choice should be made available to all of us. And that was one of the issues that came up with Joe Duffy, is that a lot of women aren't able to access hormone replacement therapy who would immensely benefit from it. When I'm discussing perimenopause or the menopausal journey with women, I talk about my 3 secrets that I share are radical self-care, slowing down and giving yourselves lots of space. The self-care bit, is non-negotiable. When you arrive at perimenopause, and if you are having a lot of symptoms, you really have to start looking after yourself. For years and years, women, we look after everybody else. We're there for everyone else. But when we arrive at the door of perimenopause, you really, for a few years, you've got to start really looking after oneself. Slowing down is very important, especially if cortisol and stress is impacting you. Try to slow down your lifestyle in some particular way. And the third one is space, which a lot of women find very interesting. It's about giving yourself this freedom. Again, it's part of the change that we're experiencing as we're going through it. Like women before COVID, women were telling me they were going off on holidays on their own. I had a woman that I met at a cafe. She, back in 2019, she was going off for 6 months traveling on her own. So the space bit, very important to understand too in relationships, the importance of having that little bit of space when we're moving through perimenopause, menopause. I go into all of these in a lot more detail in the courses that I do. I wanted to everybody that's listening or watching here today, from my own experience working with women for years as a midwife and a public health nurse, women are strong. We are strong, and what has happened with perimenopause is that we have been landed into the space with no education and no preparation, no information. Put these in place, and I can guarantee you women will overcome any of these, any adversity that's associated with it, because that's my own life experience, work experience. And this is why I couldn't understand, why is menopause so different to any other time in women's life? And it's the fact that we've no information. The education isn't there. We need an awareness and education program. Glennon Doyle, she's a New York Times based author. Her latest book has been on the New York Times bestselling list for over a year. It's called Untamed, and in it she talks about how women constantly throughout our lives, we do hard things, and moving through menopause is another one of these hard things. The problem is that many women are not getting the supports that they actually need, and that really has to change. Books I would recommend, as I said, Meg Matthews, Dr. Harry Barry's. He was talking to Clare Byrne last week, and he started talking. He mentioned menopause as one of these changes that occur, and that the importance of resilience. So it's a lovely read. I actually read it during the week, and it explains what's actually happening to us, again, from a neuropsychological, I suppose, and from cognitive behavioral therapy, that approach to understanding change and how to adapt to change and resilience around change. So that's another book I'd recommend. Perimenopause Power by Maisie Hill, Menopause by Dr. Louise Newson. It's a lovely, it's a much smaller book, but all the basic facts are there. Then for anyone that's really interested in understanding the history of menopause, The Slow Moon Climbs was published this year. Menopause Messenger and Natural Menopause. I believe going forward, what we need in Ireland is a nationwide information and awareness campaign. This is to ensure that all women get this information, and all women, migrant women, the traveling community, women with disabilities. The only way that we're all going to actually get the information is by having a nationwide information and awareness campaign. Micheál Martin said that he would consider it. That's why, if there is anyone listening today, it's about keeping the conversation going and keeping the pressure on public representatives, your TD, your local councillor, local minister, to contact them and to call for a nationwide information campaign, because bringing it into the public domain, it will demystify it. It will demystify the taboo, and that'll be at least the first step in assisting all of us to gain the information so that we can thrive as we move through these years. Because when I attended, this is a slide I took from the Meg Matthews Menopause Conference in May 2019. And as the day went on at that conference, they were talking about how education, information, understanding, and the correct supports is actually going to change the framing of menopause. And within the literature, Professor Sharon McQuaid wrote about menopause in the 1990s, and she said menopause is both a crisis and an opportunity. And what has happened is that the crisis has overshadowed the opportunities, because there are massive opportunities, second chances, access to deep creative power, access to courage and confidence that all come with us moving through this phase of life. Innate leadership potential. There's another one within the literature that is actually there. And for anyone that's interested in that, there's a brilliant paper that was published online last year, Killer Whales, Killer Women. It's talking about the empowerment of women as we move through these menopausal years. Yes, in the early perimenopausal stage, symptoms are presenting. And if we don't get on top of the symptoms, they continue. So it's very, very important. And when we look back at previous generations, that said, okay, we should keep it quiet, we should not talk about it. Many women, I look at this in pathways out of menopause. Many women, symptoms developed here during their perimenopausal years, and those symptoms stayed with them. They remained with them as they move forward. So it's so important to bring it out. Let's spotlight it. Let us see what's actually going on, what's actually happening, in order for women to get the supports that we so deserve. And I'm about to finish up now. I put up this because I love this one. Somebody recently sent it to me. Sometimes women feel the need to tame down their bold spirit when they get older, whereas some spirits aren't meant to be tamed. Older is bolder. And if you're following or part of the midlife women and menopausal movement in the UK, they're certainly becoming bolder. Another huge area, which I can't go into now, is incontinence. This belief that, in your 40s, you should end up wearing an incontinence pad. It's the greatest load of rubbish. You're never too old to start exercising or looking after your pelvic floor. And women do not have to spend the rest of their lives with incontinence. That's another massive area that needs a load of research. Relationships in menopause, another huge area that needs a lot of research. But most of all, it's about understanding ourselves, understanding our menopause, and reaching out for supports. And Dr. Clare, I'm just so delighted to have been part of the seminar this morning. I'm hoping there will be a lot more seminars throughout Ireland, because it really is, ladies, it's about enabling and it's about empowering. There is no shame in being a menopausal woman today. Absolutely no shame in it. And I'm just going to finish there with that. There's my own slide. And if there are any questions, I will take them there now, if there's anyone that wants to ask me anything. Okay, I see there's a question here about why can't menopause be managed the same way as diabetes? Personalized plans, wellness professionals. So, okay, so again, diabetes, right? Okay, so diabetes is a disease, a hormonal disease caused by the pancreas, right? By insulin in the pancreas. So yeah, that's the medicalization. That's the medicalization model. Okay, so the medicalization model would say that menopause is a hormonal deficiency disease, and I disagree with that. I disagree with the fact that it is a hormone, because if you believe that, you're straight away, you're buying into the disempowerment narrative. You're disempowering yourself straight away and thinking that it's a deficiency disease. I prefer to see it as it's a transition, and yes, there are debilitating symptoms associated with it, but you can overcome those debilitating symptoms by using whatever you want to use, be it HRT, be it herbs, be it diet. So I don't buy into the diabetes argument. I'm sorry now, and I'm looking at it from a sociological, a neuroscience. I mean, there's massive amounts of research coming out in the last 4 or 5 years around neuroscience. And again, it's about our belief structures. Like the 55-year-old brain can be as sharp as the 25-year-old brain. You need to understand that. And when women understand that, that completely changes the perspective. So if you believe that menopause is the exact same as diabetes, so you're saying it's a disease and you're going to have to live with that disease for the rest of your life, I'm disagreeing with that. I'm not going to agree with using that analogy only. That's the medicalization of menopause, and it's important, but it's only part of the much bigger puzzle, because women, we not only have hormones, we also have emotions, we have feelings, we have attitudes, and we have there's an awful lot more to us as women. It's not just hormones only. Hormones are a very important part of it, but they're not the only thing. Just there's loads of questions coming in here. I'll just try and pull up some more. Okay. Yep, on the changing the whole narrative around it. It's up to every woman here that's actually attending the seminar this morning. We have the power to change the story. We really have the power to change this story, which has been so negative for so long, and that negativity has impacted us. It's impacted the way we're actually navigating it. So I firmly believe bringing it out into the public domain, making sure that women are supported in all ways possible, and the Killer Whales, Killer Women paper, and there are a lot of new names coming into the menopausal field. They're talking about the empowerment part, because what's actually happening in the UK is let's say Dr. Louise Newson, even though she is medicalizing menopause, you know, she's talking about the medicalization of menopause, she's also talking about the empowerment. It's the empowerment about finding the answers. So women are asking for answers. They're asking for answers, and they're asking for help and support, which wasn't provided heretofore. So it's that empowerment piece that's equally important as the medicalization part. So I think I'm coming up to the end here, and I'm going to be handing over to Linda, I think is next. I hope you enjoyed that presentation, ladies. Thank you. Let's see. I just see another question there. Are you, Linda, can you hear me?
I can, yeah, go on.
Great, okay, I'll pull out, go from here. All right.
Okay, can everybody hear me? I think, has Brita gone? So hi everybody, just checking, can anybody let me know if they can hear me, please? Yes, we can hear you, great, thanks Laura, okay. Right, let me just get my screen, where are we? Oh, 1 second. So that's been really interesting. I hope everybody's enjoying the day so far. My name is Linda de Courcy. I'm a nutritional therapist and Pilates instructor, and usually pretty nifty with the screen. So share screen. Feel free to talk among yourselves. Here we go. Okay. Okay. Hopefully that's working. Yeah, so my name is Linda de Courcy. I'm a nutritional therapist and Pilates instructor. I've been teaching Pilates since about 2005, and I qualified as a nutritional therapist in 2008, and I got my master's in 2017, 4 years ago. So I do both. I do the nutrition and the Pilates. So I find they work very well together. And as everybody has been saying, you know, it's important to keep moving, and exercise is important. So I'm going to talk about nutrition today. I'm also going to do a little bit about breathing and the importance of breathing for health and for just de-stressing and calming down. So yep. So let's move on. So what we're going to do is talk about nutrition. So looking at not only what we eat, but also when we eat and how it can support optimal hormonal function at every age of life. So we want to support our hormones. We want to keep them as healthy as we can and keep ourselves healthy too. I'm just quickly going to go over the two main hormones that we're all probably aware of. Estrogen, I'm sure everybody's heard of estrogen. So it's produced, as has been mentioned earlier, it's produced mainly in the ovaries prior to menopause, and then afterwards it's generally found in the adrenal glands and also your fat cells. So that's why we want to have a little bit of weight on us. We don't want to be obviously very overweight, but we don't want to be you know, too slim as well. So we do need a certain amount of fat. So we also want to maintain a healthy amount of estrogen during and after the menopause. So estrogen is responsible for the female figure, so hips and breasts, and also keeps our vagina healthy, stimulates ovulation and menstruation, and it supports the laying down of fat stores during pregnancy, and supports mom after birth. Okay. Right, so and then, as I said, it's produced in the adrenal glands and the fat cells after menopause. It's also synthesized from cholesterol, so I'm going to be talking a little bit about cholesterol through this, so just wanted to bring that up there right now. So progesterone is also progestation, so it's helps keep the helps keep us keep a baby, helps us maintain a pregnancy. It also helps to regulate menstruation and estrogen levels, helps to burn body fat. So this is one of some of the interesting things about progesterone. Progesterone is not as well known as estrogen, but it is actually a very important hormone. It's synthesized from cholesterol as well. It's made in the ovaries prior to menopause, and afterwards it's also produced in the adrenal glands. So it also helps to reduce anxiety and helps to improve our mood. So it's what helps us cope with the day-to-day stresses and strains of life, and helps to keep us healthy and happy, helps us cope with stress. It also supports a healthy immune response and acts as an anti-inflammatory agent. So we want to focus on maintaining healthy, they obviously will drop through menopause, our progesterone and estrogen levels, but we want to maintain a healthy level. They will drop, but we don't want them going too low. And as I said, it's also synthesized from cholesterol. So some of the symptoms of the menopause, this has been discussed. So these are just some of the main ones. There obviously are an awful lot more. These are the more common ones. The hot flushes and flashes, I suppose, are the most well known. The mood swings, irritability. A lot of them, again, are sort of similar to PMS symptoms, but they obviously get a lot more acute and extreme when they can go on, rather than just for a couple of days. They can go on for months and months. So obviously that's not a good thing. So again, I'm not going to spend a lot of time on that, because it has been discussed, and if you're going through the menopause, you probably know or have experienced some of those symptoms yourself. So there are 3 factors which affect our hormonal balance, and I do want to talk about the 3 of them today, because we are going to talk about diet, but diet on its own, we can think about what we eat all day long, but diet on its own is not enough. We need to look at stress and what stress does to us, and how stress affects our estrogen and progesterone, and also some of the chemicals that we're exposed to in everyday life. So these are 3 things, and they work together. So there's kind of like, it is a big triangle, and I don't think you can eliminate one. We have to look at all 3. So I just wanted to have a quick talk about 3 of them, and then see what we can do to address each of these issues. So the first one is stress, and the whole, running from a lion, a tiger, or a bear, and thankfully here in Ireland, the chances are, well, I'm sure most people listening are from Ireland, but anyway, we don't really run away from lions, tigers, and bears, and I don't really know of anybody who has to run away from lions, tigers, or bears on a regular basis, or even an occasional basis. I think I had a friend once who was almost attacked by an alligator, but that's a very, very rare occurrence. So we do, though, experience kind of chronic stress on a daily basis, and most of the time it's not like a really stressful, like running from a lion, tiger, or bear situation. It's sort of an acute, it's a chronic, but it's subacute, so it's sort of under the radar. And a really good example, unfortunately, is the last 15 to 18 months, this constant drip of the fear mongering, and the whole everything that's going on with COVID. And if you listen to that all day long, that is very stressful, and it's not really helping people to be listening and tuning in every day and getting updates every day, because what that does is it actually increases your stress levels. So if you wake up in the morning and think about COVID, and go to bed at night and think about COVID, that's not healthy, because that's a stressor on your system, which we just don't need. So acute stress, our body can handle that, because it releases the cortisol, releases adrenaline. It sort of it suppresses your digestion, suppresses your immune response, and let's deal with this, let's fix it. And then your stress goes, you come back to a normal unstressed event, and then your body can get back to doing what it normally does. It is interesting that our digestion doesn't work as well when we're stressed, and our immune system is also suppressed when we're stressed. So the way, if you are very stressed about something, it's very hard to eat, you don't really want to eat, that's because your digestive system is like, no, we have to deal with this stress. So as I said, though, the problem is many of us in our modern lives, and especially with kids and with jobs and with cleaning the house and with trying to keep up with WhatsApp and social media and all these things, we can end up spending most of our waking days in a sort of stressed state, which is actually very, very unhealthy. And what's interesting is, progesterone is, as I said, one of the hormones in our system which helps us cope with stress, which helps lift our mood, which helps us burn fat, which keeps so many things, keeps estrogen keeps it under control, so to speak. They work synergistically with each other, but cortisol will actually compete with progesterone. So all these hormones, they're released from different organs in the body, and then they're sent to, you know, a certain area, and they have a little job to do, and they have to attach to a receptor on our cells. So what's interesting is that cortisol, which is a stress hormone that's released when you're stressed, will actually try to attach to the same receptor as progesterone, but it will usually beat progesterone to that receptor. There's more of an affinity for cortisol than there is for progesterone. So when we're in a situation where we are stressed moderately all the time, that is going to suppress our progesterone levels over time. So that's not a good thing. So again, this constant low level, you know, stress that we never really get away from is actually very detrimental to ability to take up progesterone, and then it also increases the production of estrogen. So in a healthy person with a healthy stress response and a good diet and healthy weight and all these things, you will have a good balance of estrogen and progesterone. But when you are in a chronically stressed state, your estrogen will go up and your progesterone will be suppressed, and that's not a good thing. So estrogen dominant disorders, obviously there's the estrogen sensitive cancers, but then also things like osteoporosis, muscle loss, increased risk of cardiovascular disease. They are all a symptom of that imbalance. And one of it's not the only thing, because obviously there's the three things that we're going to talk about, but increased cortisol, constant stress is actually, unfortunately, really exacerbating this problem. So what can we do? So again, this is pretty basic. It's nothing too deep, you know. So take time, don't get stressed about it, but take time to, you know, sit down and identify, you know, what things are really stressing you out. Are there any areas in your life that are more stressful, that you feel like you never get away from? And then consider what changes you can make to your routine. And also said reduce time on social media. Like, you know, these phones, these fabulous things that we all have, they're great because, you know, you can check what the weather's going to be like. You can, you know, you can do so many things, but they're also can be a bit of a, you know, they can be a blessing, but they can also be a bit of a curse. So I don't have any notifications really coming up on my phone. Any news apps, all the notifications are up because I don't need a beep every 2 minutes to tell me about a new variant or a new this or new that. You know, that's just not beneficial to me, and it's not beneficial to anybody. So I also know about a year ago, I took Twitter off my phone. I have it on my laptop, so I'm not on my laptop as much as I am on my phone. And, you know, sometimes you feel like, oh my goodness, what's happening in the world? But it's actually okay. I deleted my Facebook account 5 or 6 years ago as well, because I found none of these things constantly, you know, being on social media, scrolling, you don't feel good afterwards, and they're an unnecessary stressor. So, you know, I suppose if you spend, maybe you're not on social media at all, maybe you just have your texting and a few other things, and that's fine. But I think a lot of us, you know, if you can honestly sit down and say, like, if you spend 10 or 15 minutes, you know, scrolling, do you actually come out of there feeling better, feeling more relaxed, or do you feel like you've wasted time, that you're more stressed, that you're just annoyed at people? You know, so I think that's a big thing that we can do. Spend a little, you know, fast your phone, you know, have an hour or 2 hours in the evening where you don't go near your phone, and just, you know, spend time, talk to people, you know, talk to your family, when you're going out even for a walk with some friends or something like that. Just try and do it away from your phone. As I said, they're great. I don't know what I'd do without them. We grew up without them, but, you know, we have them now. But they definitely can be contributing to that low level stress that we actually don't need. And, you know, the chances are the world won't end if you don't have your phone, but if it does end, it's going to end anyway. So there's nothing we can do about it. And then just find some things that relax you and incorporate them into your lifestyle. I know for myself, I like buying those home and house magazines. I'm selling and buying at the moment, and so I just find, like, sitting down for half an hour maybe and just kind of flicking through a magazine, I actually find that it's very relaxing and it's very therapeutic. So find something that you like to do. It doesn't have to be every day, you don't have to be obsessive about it, but just something that, you know, helps you relax and enjoy yourself, and makes you, you know, brings down that stress response. So some simple things, as I said, there's no rocket science here, but it's important that we do some things you can change, and I suppose accepting the things you can't change is important too. But there's always things that we can change, and everything we can do to even slightly reduce the stresses that we're experiencing is only going to be good for us. So chemicals. So the other thing is the chemicals. So we've got stress, we've got chemicals, and we've got a poor diet. So there's so many chemicals. So again, all these hormones are just chemical messengers. They go around our system. They attach to cells. They do their job, and something else happens, and another release, another round of chemicals, messengers, hormones, and things will be released. Okay, so there are different types of chemicals that disrupt our hormones. So there are xenoestrogens, which are they include plastics, known as endocrine disrupting chemicals. So they disrupt our endocrine system, which is our hormone system. Phytoestrogens, which are found in legumes and pulses, and I don't want to spend too much time talking about them today, but Asian peoples never drank soy milk. They never had soy yogurt. They didn't have soy as kind of a main. They didn't eat tofu. Any soy they ate was was generally fermented. So they would have had miso and tempeh. So it was obviously organic. It wasn't genetically modified. It wasn't sprayed with pesticides, and they used it as a condiment. So they would have had maybe a teaspoon. So it was never, a big portion of their diet. So as I think Laura was mentioning earlier, that they do go in, and they are kind of they do affect our hormones. And so small amounts can be beneficial, but a lot of women unfortunately believe that eating large amounts of phytoestrogen rich foods like soy, like pulses, is beneficial, and it's simply not. And soy is particularly, especially soy milk and all these things, they're particularly dangerous because they're massive doses of xenoestrogens, and they also contain components like phytonutrients, which actually strip the minerals from our system. So they'll strip the calcium, they'll strip the iron, they'll strip the magnesium, so all those things. So fermented soy in small amounts can be quite beneficial, but unless you're very estrogen sensitive, but otherwise it's definitely best to not have it on a daily regular basis. So other foods, again, non-organic foods and residue from pesticides and herbicides, artificial ingredients, skincare products. Some of them contain so many different chemicals that are actually very toxic, and they affect our hormones. Synthetic hormones like the pill, that sort of thing, and they are fairly ubiquitous in the environment. So we can't eliminate them. What we want to do is just reduce the number of them that we're exposed to. I thought this was an interesting slide. It's just going through the different types of estrogens that we're exposed to. So there's the natural ones, and then there are the synthetic ones. So you can look in that and you can see which ones can I start removing from my life, and stop absorbing them. So one of the best things that you can do to reduce your exposure to xenoestrogens, to hormone disrupting chemicals, is to stop drinking from plastic and stop eating on plastic. Never ever use plastic on hot food. Never ever heat in the microwave with plastic. Get yourself a nice stainless steel or tempered glass water bottle and use that. It'll save you a fortune on plastic bottles. It'll save the planet, but also every time we use plastic, especially for eating or drinking, we are ingesting some xenoestrogens which affect our hormones. So they're affecting our estrogen. They're stopping our estrogen and progesterone from doing what it wants to do. And what's happens then as well is, so these xenoestrogens, they get in and they can attach to our receptors, but they don't actually do what the actual estrogen and progesterone is supposed to do. So what that does is then our body is like, okay, well, the estrogen isn't able to get in and do its job, so it actually releases more estrogen. So we end up having too much estrogen in our system because the xenoestrogens that we are absorbing and exposed to are actually affecting that. That's why they are called endocrine disrupting chemicals. And again, we can't totally eliminate them, but you can significantly reduce your exposure to them. So use a nice glass or a mug when you're drinking your tea and coffee, or good quality stainless steel. not aluminium. So increase your intake of organic or locally produced seasonal foods. So if you buy, you know, carrots in season and you buy apples in season and they're locally produced, they're not really going to need to be sprayed. Whereas when we're getting fruit and vegetables from, you know, South Africa, New Zealand, all these far-flung places, they've generally been sprayed to preserve them for their long trips. So locally produced seasonal food is really the best way to go, as much as possible. So again, this isn't something we have to do 24/7 and not something that we want to stress about, but just something that we can be aware of. Change the products you use on your skin. So I don't know, obviously, what everybody uses out there, but a lot of the, you know, have a read of the ingredients. You probably will need a magnifying glass because they make them so small. There's a really interesting website called EWG, Environmental Working Group.org, I think, and they go through a lot of the chemicals that are used in so many skincare and so-called beauty products, and a lot of them are there. They will all affect our hormones, but they can also be carcinogenic. They can be cancer causing. They can cause all sorts of problems as well. And they can definitely affect our reproductive system. So we want to avoid them as much as possible. There's some great Irish products. These are just some of the ones that I use, like Dublin Herbalist, the Burn Perfumery, Airmid soaps. So have a look at, maybe have a Google of Irish cosmetics. They have a lot less toxins in them. They're locally made. A lot of them use kind of their own, like I know the Airmid soap use their own lavender and they use their own beeswax. So they're much more local, they're much more ethical and sustainable, but they also don't contain nearly half as many or hardly any of the toxins that we would get in sort of the so-called expensive or even cheap brands that you would buy in a supermarket. So that's another thing as well that we can easily do. It's easy to change these things. And again, so you're reducing the toxic load, reducing the number of xenoestrogens that are you're being exposed to. And then only wear SPF, so sun protection factor. You know, we only should wear it when we're outside and the sun is too hot. You don't need to wear it in December. Try to buy moisturizers and stuff that are SPF free, because again, you really only need to be wearing it when you're outside and when the sun is too hot for you, because again, they are chemicals and they are disrupting our hormones. And so when you think about all these chemicals being absorbed into your skin, you know, if you're trying to give up smoking and you have a little nicorette patch on your arm, you know, it's amazing that tiny little, you know, patch can release enough nicotine to make you feel like you don't need a cigarette. I hear, I've never smoked, so I don't know, but think about that little patch, the effect that can have. And then if you're putting these moisturizers and different chemicals on your body, the effect that they can have. So again, not trying to freak anybody out, these are just interesting, easy things that we can do to reduce our toxic load and to reduce the amount of xenoestrogens that we're being exposed to. So that will reduce their effect on our estrogen and progesterone and other hormones as well. Okay, so dysglycemia is basically glucose is obviously blood sugar, is a sugar that's in the blood. So it's abnormal blood sugar levels fluctuating between very high and very low. So basically what goes up must come down. And what we want is we want our blood sugars to stay as stable as possible. And unfortunately, so we're starting to talk about actual food now. Unfortunately, many of our dietary habits, they are triggering a roller coaster of blood sugar. So our blood sugars go very high and then they go very low. Then we eat, they go very high again, they go very low. So that's unhealthy. Our body is very interested in maintaining what's known as homeostasis. So where everything is fairly level. And if something gets out of whack, it will do everything it can to bring it back down. So what you don't want to do is stress your body out, stress your digestive system out by constantly having a sugar rush and then a sugar drop. So what we want to do is we want to modulate that, and I'll talk about that in a second. But what a drop in blood sugars do, so when your blood sugars spike, so if you have like a breakfast cereal with low-fat milk or something, or if you have toast and jam with coffee, your blood sugar is going to go very high very quickly, and then it's going to drop very low very quickly. So you'll know that because suddenly you'll be like cranky and give me some food now. So that's what we want to avoid. So, you know, as I said, I'll get back to how to avoid that in a second. But what that does is, so the blood sugar dropping too low is a stressful situation. So again, that releases cortisol. So we want to avoid unnecessarily releases of cortisol. We don't want to be giving our body a reason to release cortisol when it doesn't need to. We want it to be there when we need it, but we don't want it in our system unnecessarily. So that dysglycemia is and avoiding that and reducing that is a really good way to avoid that unnecessary, as I said, unnecessary release of cortisol. So chronically elevated insulin leads to increased risk of low mood, memory issues, achy joints, and chronic disease. So does that sound like a menopausal issue? And again, so I think a lot of times as well, if we are struggling with symptoms in our menopausal years, we've probably had a diet that hasn't been very healthy. We've probably been exposed to toxins and chemicals, and we've probably been living on a bit of a stress roller coaster for years before that. And it's just when our estrogen and progesterone levels naturally start to drop, they've been kind of maintaining us on a certain on a certain level, and when they start to drop, and then everything just sort of gets thrown out of whack. And I think if we've had that sort of not great diet and sort of chronic low-lying stress, and again, without even knowing it, thinking we're doing good by all the things that we're exposed to, even just like constant SPF and all that sort of thing, that can actually make the menopausal symptoms worse. That can make them more acute and seem more extreme. But the good news is that we can change our diet, and we can reduce the symptoms, and we can kind of get through it with a lot less discomfort and dis-ease. So obviously weight gain, again, that roller coaster will cause weight gain, particularly around our waist, the areas that we're least likely to want it, and it's very common with dysglycemia. So and as I said, they're all likely to be exacerbated as we enter our menopausal years. So it's just, unfortunately, we've been told all these things are good for us, and they're just, for the most part, they're quite often not. So looking at diet, you're probably wondering when I was actually going to get to actual diet. So are we too reliant on processed foods? And I know they seem convenient, and I know if we're busy, we're running around, we're trying to keep on top of everything, keep in touch with everybody, and cooking seems to be, I know kind of, I don't think Mum really enjoyed cooking because she kind of had to cook for us, and then my grandmother lived with us, and she would always have a different meal, and I had one brother who was a bit fussy, so she ended up cooking 3 different meals most evenings, and we just kind of come in and as kids do, and then leave, and so I don't think I had a very good attitude about cooking when I kind of moved out. And so I had to watch myself, that I, just didn't feel like, okay, well, cooking is a waste of time. And, I'm not saying everybody has to spend hours cooking every day, but, spending a little time making, a meal, it doesn't take very long. And generally home cooked food is going to be a lot more nutritious than processed food. So are we too reliant on processed foods? Are we too reliant on stimulants? Do we live on caffeine? Do we live on sugar? Maybe we live on nicotine. Are we too reliant on carbohydrates? I know I found I used to be kind of terrified of eating fat. I was raised to think for some reason that fat was going to make me fat. And so I would get some diced lamb, and I'd spend ages chopping every little bit of fat off of it before I cooked it. And if I had a lamb chop or a pork chop, I'd cut all the fat off. I wouldn't eat the fat. And, I still ate some fat, but I was really, really afraid of being fat. And, I struggled with weight issues for a long time. I had really bad skin. I had really bad periods. The cramps were really intense, and just feeling, again, I was on that very much dysglycemia. My sugars would go up and they would drop, and so it was very it's a very unpleasant way to live, and you're always a bit on edge, and you never really enjoy eating food, because I'd always think, if I eat this food, I'm going to get fat. And so I've had a very interesting relationship with food over the years. And it was only when I suppose did the nutritional therapy and then kind of kept looking in and researching that I realized I actually do a lot better on a low carbohydrate diet. And I think most of us do, because I'll come back to that in a second, but so I do understand, because I have been overweight. I've been frustrated with being overweight. I've kind of been craving carbohydrates, and used to drink an awful lot of Coke and Pepsi and that sort of thing as well. So I just know they don't do anybody any good. So So, you know, are you very reliant maybe on bread, on biscuits, on sweets, on crisps, milk chocolate, not the dark chocolate, say bagels, croissants, cakes, muffins, cereals, rice cakes, alcohol, soft drinks, juices, you know, do we put sugar in our tea and our coffee? So if those foods comprise a lot of what we're eating, then the chances are we're too reliant on the carbohydrates, and that's causing this dysglycemia. So reducing those is key to reducing the effect of insulin in our system, which again reduces the cortisol release, which helps to keep our hormones in balance. So it is all working towards maintaining a nice balance of our estrogen and our progesterone, but also making sure that the smaller amounts that are released during and after menopause can actually get in and do their job. So we're not having endocrine disrupting chemicals affect their ability to get on the cells, and that we're not having too much cortisol suppressing progesterone getting in and doing its job. So as I said, it's all working together. So, and processed foods also contain higher amounts of endocrine disrupting chemicals. So all those things that we talked about earlier. So there's two things we can do. We want to change when we eat, and we also want to change what we eat. So the first thing is when to eat. So maybe you've heard of intermittent fasting, and I suppose there's a lot of extremes out there. So this is not about an extreme change. It's about a moderate change. So intermittent fasting seems to do really well, like the extreme forms of intermittent fasting seem to suit men better because they have more testosterone, they do well for longer periods. You know, it's easier for men to go 24 hours without food and feel good than it is for women. So I'm not recommending any of the extremes of intermittent fasting. What I'm suggesting is that you increase the time between your dinner and your breakfast the next morning. So the reason we want to do this is when you eat food, and if you eat glucose and if you eat any sort of carbohydrate, it takes about 8 or 9 hours for that to be totally metabolized and taken out of your bloodstream. So it goes into our stomach, is into our intestines, is taken out through the liver, and then brought to our cells and brought to our muscles. So it takes about 8 or 9 hours for that process to happen. So what we want to do is after that is all done, so there's no real available glucose. If you are using any sort of energy, you will need fat cells then to be utilized as a source of energy for fuel. So what we want to do is we want that, because just using glucose all the time is not metabolically very healthy, because we all have fat cells, and that's good. We're supposed to have fat cells, but we want them to be used as a source of fuel. So what you do is when you increase the time from more than 9 hours, so a lot of times I find people snack just before they go to bed. So they have their dinner maybe 5 or 6, and then you're sitting in front of the TV, especially at the moment, because there's nowhere to go. So we're sitting in front of the TV, and then you're eating biscuits or you're eating crisps, and very few people eat healthy food at night, or else we're drinking wine or something else. And so then you're ending up kind of having food in your system kind of at 9 or 10 at night, and then people get up and then they're eating maybe at 6, 7 or 8. So there isn't a very large gap between the time we have our dinner and the time we have our breakfast. But if you can increase that so that you don't eat so late at night, that you have a slightly later evening meal or a slightly larger evening meal, and maybe instead of having a snack at 10 o'clock, have it at 8 o'clock, so that then you have at least 12 hours, maybe 13 or 14 hours. So maybe you have your breakfast at 8 or 9. That gives your body those few extra hours where you're giving your digestive system a break, which is really important. You're giving your liver a break, because your liver actually needs to do other things other than digest food. So if you're digesting food all the time, your liver is kind of unable to support the immune system. It's unable to necessarily properly break down all these endocrine disrupting chemicals that we're exposed to. So we want to give our livers a break. We also want to give our pancreas a break. So your pancreas is where insulin is released from. And again, so giving that a break gives it a rest. It makes it more sensitive, and it just helps it function better for longer. So again, this is not extreme. So if you're looking at intermittent fasting after this, you will see the really, really extreme. I'm not talking about that, and see how you go. So say at the moment you have maybe something to eat at 9 or 10, and then you have your breakfast at 6 or 7, just increase that by 1 hour either way. So don't be too dramatic about it, especially if you're overweight or you're feeling very, unhealthy. Take it moderately. So we want to do these things moderately. So increase it maybe by even 30 minutes the first couple of days, then by an hour, and see how you feel. And if you're starting to feel really shaky in the morning, then have something to eat, but then hopefully the next day you can do it for a bit longer and a bit longer. And it's an easy way to do it, because usually when we're sleeping, we're not eating. So that's a good way to do it. Just gives your system a break, gives your stomach a break, and it's really good. So increasing the time between your dinner and your breakfast, and then limit the number of times you eat each day. If you eat a meal and you're hungry in 30 minutes, then the meal wasn't satisfying enough. It wasn't fulfilling enough. If you have to eat 6 or 7 times a day, and I know a lot of us have been told that we need to kind of graze, but we're not cows. Cows don't have an awful lot of else to do with their day. They're out in a field. They have 4 stomachs. They literally chew the cud all day long. Our digestive system is more like it's more like a cat or a dog. They eat and then they don't eat again. They don't eat all day long. So we have a shorter digestive system. It's not made for constant grazing. So you want to limit the number of times you eat a day. So if you're, say, eating 6 times a day, that includes all your snacks, try to cut it down to 5. Increasing the amount of food you're eating with each meal, enough to get you 3 or 4 hours to the next meal. So again, just when to eat is very important, as much as what to eat. So give your liver a break from digesting food. So that's, as I said, should have gone on to the slide before. Encourage the body to utilize fat as a source of fuel rather than glucose. Give your stomach and your pancreas a break, and that also means less insulin in the bloodstream. So again, the insulin affects your cortisol. It's a stressor on your cortisol because and everything it also affects your estrogen and your progesterone level. So insulin is sort of the master hormone. So when you keep that regulated by reducing the number of times you eat and keeping the foods that you eat from producing too much insulin, it's only good for your system. Okay, so we want to control our blood sugar levels. So this is another thing that we can do. So this is what should we be eating? So we want to reduce our carbohydrate intake at each meal. So again, if you go back to the list of things I was talking about, the biscuits and the bagels and the muffins and the bread and the pasta and everything else, rice cakes, all those sort of things. So they're all carbohydrate rich foods, and they all cause our insulin levels to rise, and depending on how much carbohydrate we have in a meal, they will rise quite quickly or quite slowly. So we want our insulin levels to rise more slowly. We don't want a big spike. We want a gradual, just like a nice walk up a low hill, rather than trying to climb Mount Everest at warp speed. So if you're using rice and pasta, so you want a max of 25 grams per person per meal. So I recommend weighing that, because if we don't weigh it, I know when I started weighing it, I don't know, maybe 10 years ago, I was like, oh my goodness, this is such a small amount, but actually it's more than enough. And then you fill up your plate with other foods. And so one small slice of bread, so preferably sourdough. Sourdough is really good because it pre-digests the flour, so it makes it more bioavailable, more easy for you to get the good B vitamins, the magnesium, and the proteins out of the bread. Obviously, organic is best, and locally, like a small producer rather than from a supermarket. But if you can't get it anywhere else at the moment, start getting it from a supermarket. And increase your non-starchy vegetables. So starchy vegetables are generally the ones that grow underground. So you have your carrots, your parsnips, your potatoes, all those sort of things. So try and not eliminate them, but then reduce them. So you don't want kind of 25 grams of pasta and then 3 large carrots and 4 potatoes with your meal. So increase your fat intake. So what fat does is fat slows your digestive system right down. And I'm sure most of us, either consciously or subconsciously, I know, as I said, for years, I was pretty afraid of fat. I just thought what fat would make me fat. And so I tried to avoid it. And I had this roller coaster of sugar spikes and dips. So when you increase the amount of fat in your meal, it slows your digestion down. It keeps you full for longer, and it also provides some vitamins and minerals that are essential for health, which I will talk about in a second. And then good quality dairy, cheese and cream. Avocados are great. Make sure you kind of get nice ones that that don't break the wall when you throw them against the wall, that they're ripe and ready to eat. And then some fatty cuts of meat, and then moderate amounts of, I did have the amount there, so that obviously disappeared. So that should be 0.8 to 1 gram of protein per kilogram of weight with each meal. I don't know how that happens. Anyway, so sorry, that should be there. So you want about good quality protein. So 0.8 to 1 gram of protein. If you want to weigh it out, just if you're not sure, unfortunately, when a lot of people try to reduce their carbs, they end up eating far too much protein. And like estrogen, too much protein, too much estrogen makes things grow. So we don't want too much protein. We want an adequate amount. So weigh yourself if you need to, and then just keep that sort of moderate amount of protein. Okay, so I do want to talk about vitamin A and vitamin D just quickly, and I'm going to go quite quickly because we're getting through time here. So vitamin A, so most of us know about vitamin D, and I know Lara mentioned it earlier, and it's so important for so many things. I'll talk about it in a minute, but vitamin A is also as important, and it's been much maligned because when you take it as a high dose supplement, it can be dangerous, which is the same as everything else. You know, most things in moderation are good for us, but when we take them in isolation and excess, they're actually unhealthy. But if you take vitamin A with food, and if you increase your uptake of vitamin A rich foods, it will benefit you in many ways. Okay, one of the interesting things it does is it helps transform white fat cells into brown fat cells. So I don't know whether you're aware, but we have two types of fat cells. So you have your white fat and you have your brown fat. So the brown fat is more metabolically active. So what that does is it actually keeps you warmer. It actually burns more calories per day than white fat. So we want more brown fat and less white fat. Vitamin A will actually help transform the cells from white fat into brown fat. There's other things that you can do as well, but vitamin A is key for that. So it's essential. Most of us know it's essential for good eyesight. So now this is retinol. This is not the beta carotene. We need the preformed retinol, which you get from animal fats. It's also good for healthy bones, and it's really good for healthy skin as well. So if you feel like your skin is very dry, obviously we need our B vitamins, but we also need vitamin A as well. So it upregulates genes to protect the heart. And unfortunately for people who have diabetes and obesity, they tend to have lower vitamin A levels, and then these genes can actually be switched off. So vitamin A is protective for the heart, again, from good quality food sources, not synthetic vitamins and minerals. Supports the optimal immune function, so it reduces the severity of tuberculosis, measles, and HIV. So having a good baseline of vitamin A is actually supportive for our immune system. It modulates the inflammatory response. So again, it tempers, and especially going through this period of life, the menopause, where things tend to be very inflammatory and the flushes are very extreme and everything, that helps to temper that. And it's also vital for reproductive and respiratory health, and it's essential for the brain to function optimally. So for all these things that we are experiencing in this journey of life, vitamin A is really essential for helping to modulate everything and help everything work as well as possible, especially for our brains, for the brain fog and the confusion and the anxiety and all these things, not being able to cope with little things. Vitamin A is really important. I just like that picture. I was over in Boston back in the olden days, with my aunt, when I used to be able to travel without even thinking about it. So it was probably 7 or 8 years ago now. So the yellow butter is Kerrygold, because being Irish, you would always buy Kerrygold, and the white stuff is actually American butter from grain-fed cows. So you can see the difference in the quality. So we have some of the best quality dairy on the planet. We have some of the best quality meat as well on the planet, because we have all this fabulous rain, which gives us all this beautiful grass. So, but you can clearly see the difference. So the more yellow, the more golden the butter, that means the more natural occurring vitamin A and vitamin D, vitamin K, CA, and all these other really, really good things in it. So these are some of the best food sources. So only have liver once a week. You don't want it if you can. Not everybody likes it. You might find some nice liver pate, free range liver pate. You can have some butter, some cream, free range eggs, and then raw milk and other dairy products. So that's retinol. Again, that's not the beta carotene. So there is a difference. Beta carotene doesn't really convert to vitamin A, very, very small amounts, and not enough for us that we need. And then, so actually vitamin D is a hormone. Again, I think this was mentioned earlier, and it's synthesized from sunlight on the skin using cholesterol. So again, we don't want to be doing things to artificially suppress our cholesterol level. We don't want to be too concerned about our cholesterol. We need cholesterol to synthesize estrogen, to synthesize progesterone, and to synthesize vitamin D, all of which are really important for getting us through this period, helping us to kind of maintain that stability and not have the too much of a dip in progesterone and the spike in estrogen, or even a drop in estrogen, which can happen as well. So SPF obviously blocks the process. So as I said, try not to wear SPF, you know, try to get out a little bit if you feel you're quite sensitive, even just for 5 minutes, get out in the sun and then come back in and cover yourself up, but get a little bit of vitamin D. Vitamin D is so important for our immune system. There's so many studies in the last year and a half that showing, interestingly, like the Mediterranean peoples, you know, in Spain and in Italy, the mortality rates were really high in some of these older peoples in these nations, but they had very low vitamin D levels, even though they were living in lovely sunny climates. But the Scandinavians and the Finns had high vitamin D levels because they knew they ate their oily fish, they took their cod liver oil because they knew they didn't have access to enough sunshine, and they had much lower mortality rates, especially you know, this time last year. So it's so important for our immune system, really important for our reproductive system, our respiratory system, keeps us healthy all around. And again, it works with vitamin A, so the two of them work together. Vital for mental health. You know, I find of so many clients who just find the littlest things are really stressing them out, but when we get them off the carbohydrate roller coaster and onto some really good quality fats, those things don't faze them anymore, and they're just, their brains just function so much better. So we need these fat soluble vitamins for pretty much every organ and every system in our bodies. Okay, so some food sources. Oily fish, that's not farmed salmon. Farmed salmon is not really a good source. Liver, dairy fat from grass-fed animals, animal fat, like from free-range pork and stuff like that, has to be free-range, and then free-range eggs. Okay, so want to quickly talk about salt as well. About a year and a half ago, so I'm 50 now. So about a year and a half ago, I know a few times I was teaching Pilates, and I suddenly thought, gosh, it's getting really hot in here. And everybody else was like, no, we're fine. And I realized, oh, I'm having a bit of a hot flush. So that was a bit of a shock to my system. And I was a bit in denial about it for a while. It's funny that Breed was talking about that, but I was like, no, this isn't happening to me. Anyway, so I did sort of eventually have to reconcile with that. But the only symptom I've really had has been kind of having these flushes. So I know that when you have a flush, obviously you sweat and you perspire. So I definitely was increasing my salt intake, because I find if my salt gets too low, I start to feel really bloated and sluggish, and I don't sleep well at all. So so the recommended daily allowance for salt, the WHO recommends we have about 4 or 5 grams, which is actually a heaped teaspoon. So I would imagine many of you out there try to avoid salt just like you try to avoid fat, because you think it's good for you, but actually salt is vital for life. You know, and the words soldier and salary come from salt, because wars literally used to be fought over salt. It was that vital nutrient. So so too little salt in our diet will actually increase insulin resistance and diabetes, increases your cravings for carbs. So if you're trying to reduce your carbs, have a little more salt, and you actually find the salt craving is a physiological need. We need salt. The carb craving is just sort of an addictive thing. So we need salt. So let yourself have a bit more salt while you cut out the carbs. Increases the risk of metabolic syndrome, weight gain, increased blood pressure, increased cardiovascular mortality, and then more likely to fall and fracture yourself, and then also more likely to cramp, especially during exercise. So too little salt. I'm just going to go through these really quickly. So again, we're all told like salt increases your blood pressure, but actually if you've too little salt, in 41% of people who don't get enough salt, they will actually have an increase in blood pressure. So too little salt will actually stress you out, and then increase your blood pressure. And then if you have blood pressure, too little salt is only 37% of people with so if you have blood pressure and you're eating too little salt, you are also possibly going to increase your blood pressure with too little salt. And then in healthy controls, eating too much salt actually doesn't affect your blood pressure. So I'm not saying go have 10 grams of salt every day. I'm saying add good quality. I think sea salt is better because it contains iodine, which is also really important for our thyroid, which we tend to be very deficient in. And then lots of salt. So in 80% of people with normal blood pressure, they're not salt sensitive. So you're not going to affect your blood pressure by the salt you eat. And I know, it's funny, I know an awful lot of people who would have quite low blood pressure. And then we have, kind of have the really cold fingers and toes and very poor circulation. And then when they increase their salt, if I can get them to increase their salt a little bit, they find it improves their circulation. So And again, that was something I really experienced. I'd like my fingers would go totally white, and none of it was in any way cold. So the extra salt actually really helps to combat that. So yep. So on to Pilates. Okay, so Pilates is it's a great form of exercise. I teach mat-based Pilates. There is Pilates you can do on a reformer, but I teach the mat-based Pilates, and it's basically 4 main things. It's breathing, it's muscle work, it's muscle lengthening, and it's also brain work. And it's so good because what Pilates does is you forget about everything else for the hour that you're in the class. So you're focusing on what your muscles are doing, you're focusing on your breathing, you're focusing on your movement, and actually you come away and you've like forgotten about all, you know, the cares of the world over that hour. So that's why it's so, one of the reasons it's so therapeutic, that your stress response actually comes down. So your body and your brain get a total break from you know, the stresses of life and the strains of life. And so that's actually really, really beneficial. And people don't always associate that with doing an exercise like Pilates. So it's not like going for a walk in the park and thinking, I have to get fit, you know, which is actually more stressful. Pilates is, well, it should be fun. I try to make my classes fun. I think it's important to have a good laugh, but it's good for our brain, because first of all, we're firing new neurons. So you're training yourself to work in a different way. You're training your arms and legs to do things in different ways, and that's really good for the brain. And then you're forgetting about everything else because you're focused on this good exercise program. So yeah, so that's really good. Yeah, so that's one of the reasons I like it so much. So I'm going to go upstairs into my studio and do a few exercises, just breathing exercises with you. But as we go up, just excuse me while I move things around. Hopefully I don't lose anybody. No, I think they're still there. Okay, so so this study found that just doing Pilates 3 times a week for 8 weeks beneficial effect on menopausal symptoms and urinary symptoms as well. So thought that was really interesting. So there aren't an awful lot of studies, particularly on Pilates. There's a lot of studies on yoga, because yoga's kind of been around for longer. But I think a lot of the yoga focused on breathing and yoga focused on stretching is very similar to the things we look at in Pilates, which is the breathing and the stretching. So apologies, just maneuvering myself around. Camera not available. Where's the camera gone? Yeah. Okay. Oh, there we are. We're back. Okay, right. Okay, so hopefully you can see me. So just going to talk a little bit about what's the next slide. Yeah, so these are the benefits of breathing. So we're going to, I'm going to lie down. You can do this sitting up. So if you want to sit up, if you're sitting on a chair, just try and sit as tall as possible. I'm just going to get you to put your hands right here just to start. Okay, so try to keep your shoulders as relaxed as possible. And if you're sitting on a chair, maybe sit at the very edge of the chair, just so that you're kind of able to sit as tall as possible. So put your hands kind of on your ribs here, under your bust, but not right down here, right here. And then take a deep breath in through your nose, and then just breathe out through your mouth. And then take a deep breath in and breathe out. And one more time, take a deep breath in and breathe out. Okay, so as much as possible, we want to breathe in through our nose and we want to breathe out through our mouth during Pilates. Okay, so what I'm going to get you to do now is bring your thumbs to face forward, so they're facing around your ribs, and then put your hands to your side like this. So take a deep breath in and breathe out. And again, deep breath in. So you hopefully feel your ribs expanding a little bit, and breathe out. And one more time, breathing in. And then breathe out. Okay, so what that is doing is that's getting the oxygen down into the bottom of your lungs. A lot of us tend to breathe very kind of shallow up here, and we have an awful lot of potential to get oxygen down into our lungs. And so that gets the breathing in, and putting your hands here makes you think about your ribs. So hopefully you felt your ribs
expanding a little bit and then contracting. So in Pilates, the breathing is very focused on deep abdominal breathing, getting as much oxygen as possible into the lungs. So what that actually does as well is it helps to increase blood flow. So when you breathe in more, you get more oxygen going into your blood, it goes all around your system, and then as you exhale, you get more toxins, carbon dioxide, and other, you know, things that need to be eliminated from your lungs eliminated. So breathing in through your nose and breathing out through your mouth. Okay, it also reduces the risk of injury during exercise. So interestingly, if you are exercising, and a lot of times when people start Pilates, you know, we're focusing on the exercise and we stop breathing. I'm like, no, just keep breathing, because that again keeps the blood flowing, and keeping the blood flowing is such an important thing. I find often as well when people start, they get a little bit dizzy in the beginning because all that extra oxygen, it's like a natural high in the brain, and people start feeling a bit dizzy. So it's just extra oxygen getting into our brains, which is really, really good. When you think about that, you want as much oxygen getting into your brain as possible. And so sometimes it's just the first few classes. For other people, it's a few months, but then it always passes. So the brain gets then used to that extra oxygen. So we want as much oxygen as possible getting into the brain. So as I said, it helps to reduce stress levels. Okay, so I'm just going to quickly, hope I'm okay for time, Tara, just going to lie down and just show you quickly a couple of exercises that you can do. So you can do these sitting up, but it's nice to do them lying down, because it's sort of, your back is then nice and straight. Quite often when we're sitting up, we're not aware of where our back is. Okay, so I'm going to get you to make a triangle with your thumb and index finger. Put the bottom of your hand here on your hip bones, and so you've got that triangle which is below your belly button. Okay, and you're just going to take a deep breath in. Try to keep your elbows down. If they don't reach the ground, just try to keep them as relaxed as possible. And if you need to put a pillow under your head, not your hair, if you feel, a lot of people find it's quite uncomfortable to lie on their back like this, so feel free just to put a pillow under your head. Just, you don't want any pressure in your neck. So take a deep breath in. So breathing in like this, like we just did, and then as you breathe out, try to think about pulling in that triangular area there. So deep breath in and breathe out. So pulling in there, again breathe in. So feeling the breath coming in there, and then breathe out. And then 2 more times, deep breath in. And breathe out. So empty your lungs. So totally, like, try and totally empty your lungs. Feel them closing. And 1 more time, breathe in. And then pull in. Below. Okay, so I hope you were feeling that. Okay, so just going to do a couple more things and just to sort of release some tension in the shoulders. I'm going to get you to reach your arms up towards the ceiling, and as you inhale, just roll your shoulders, so like you're separating your shoulders, reaching the arms up towards the ceiling. You can do this sitting up as well. So if you're sitting, just, you know, reach the arms forward and then slide them down, but try not to collapse the spine. Okay, so you're inhaling, reaching up, and then exhale, slide them in. Try not to bend the elbows, so that is just about the shoulders. So deep breath in, exhale, feel the shoulder blades connect with the mat. Inhale and exhale, and 1 more time. Inhale and exhale. Okay, and then from there we just do some arm circles. So when you're circling, you want to again keep yourself as neutral as possible. So you don't want to overarch your back here. So your ribs should be on the mat and your lower back just naturally off the mat. So again, if you were standing tall, this is the position that hopefully your spine would be in. So you're going to take a deep breath in and then exhale, circle around and back down. Inhale and then exhale. And 1 more, breathe in, and then circle around, and then go the opposite direction. So take a deep breath in, and again, nice and slowly, don't be in a rush. So often women, we're in such a rush to do things. So nice and slowly breathe in, and breathe out. Okay, feel free to do those as often as you like. They're really good. They just really get that shoulder blade moving, and quite often we carry a lot of tension in our necks that we actually should be, our shoulders should be doing a lot of the work. So that breathing in, the moving of the arms and the shoulders can help take a lot of the tension out of the neck. But as I said, if you're feeling your neck when you're lying on your back, just put a bit of a cushion under your head. So the benefits of breathing through the nose, we tend to breathe through our mouths, and actually breathing through our nose is much more beneficial. So it obviously filters the air, so it captures toxins like viruses and other bacteria, stops them actually getting into our lungs, warms the air, produces nitric oxide, which again helps dilate blood vessels and increases the supply of oxygen to our bodies, which is always a good thing. Also reduces the risk of tooth decay, helps you reduce your risk of snoring, sleep apnea, bad breath, and asthma. So just before I finished, meant to say as well, so yes, as I said, when I accepted the fact that I was having some flushes, and at that stage in my life, as I said, that was really the only symptom I had. And I found staying cold, I just sort of, you know, kind of probably most of like a lot of last year and early this year, I just thought, you know, I just need to wear less clothes during the day, and I found that really helped, because I like to layer up, especially if I'm sitting and studying. I kind of would like to layer up, and I'd usually have a hot water bottle as well, because I would feel I'd get cold, but I just sort of, I was like, okay, it's better to be a little cold than having those rather unpleasant flushes. So I found that really helps. And I also got the Herbal tincture that Lara was talking about earlier, and I found that really worked really well. So they have pretty much disappeared. So as I said, just for me, for this worked for me, the salt really helped, because, you know, you sweat a lot, you need to reabsorb your salt, and staying cooler, as well as obviously my diet, which I suppose I fixed that in my 30s, so that's has helped me through this. But then the woman definitely did help. It was a real benefit. So yeah, so that's me finished. Has anybody got any questions? Am I missing any questions? There's 2 questions there. Okay. No. So Tara, are there any questions for me, or? Nope. Okay, so I generally work with people with nutritional therapy. I do 12-week programs, because I find that it takes a while to iron out all the things. You know, when people start changing their diet, something will come up in a week, something might not come up for 4 or 5 weeks. So I find over 12 weeks, we generally get to have a long enough time together that we get established in good dietary changes, and people feel confident then to keep up with their changes. So I generally charge 325, but I'm offering a €30 off for anybody who's watching this today. So it'll be 295 if you book in by Monday, the 7th of June, and just mention that it's about the menopause, and you're on this webinar. And then I'm also thinking about doing maybe small group programs. So that should, be 225, not 295, which would be maybe five ladies together going through, you know, all the changes and all the things that we're experiencing, if that helps people. So if anybody's interested in doing that, so we'd meet every second week. So in the 12-week program, we meet every second week, and go through, you know, diet and changes and how you're feeling and all this sort of.
So I'm delighted to be talking to you after such eminent speakers. And I think what's absolutely fabulous so far is that although we all work independently from each other, we all see things in very much the same framework. And that's it, that the menopause doesn't just drop in like a parachute into our lives, as though it's not connected with anything else. And I see it very much like the previous speakers, as connected to the power of being a woman and a change in that power. It's not that we go from a situation of strength to weakness. It's that we change from one kind of strength to different kinds of strengths. So I'm going to give an overview. I'm not going to get into details. So I'll say at this point that if anybody wants a lot of research details about some of the herbs that I'm going to be talking about, or that I use in practice, this is going to be kind of what can I do? Where can I get things? You can get them from anywhere. Any of the herbs that I'm talking about, you resource them anywhere you want. We have a whole dispensary here in Galway, but there are you can grow your own, you can dry your own, you can use them throughout the years, you can get them from other suppliers. But we put these herbs together in convenient teas, tea sachets, and a bottle, and a jar of cream for convenience, because that's what I'm about, making these things accessible to people any way that they want to use them, blend them, connect them, grow them, make their own tinctures and teas. I celebrate all of that. I don't want to sell any nettles between May and the end of August, because you should all be out picking your own. At the moment, anybody who's in menopause, go out and pick some hawthorn leaves, put them in your teapot and use them. Nettle is also very strengthening, as in grasp the nettle. But here's the thing, this might be too hot for some people. So, and especially at the time of the menopause, herbs like garlic and nettle sometimes are too heating. So herbs are individual things. They're suitable for terrain, constitution, temperament. So if you're a hot-headed, fiery person and you're going through the menopause, then the nettle might not be the right one for you, and garlic might be too hard to tolerate. So then some of the gentler herbs, very few people find that chamomile doesn't suit them unless they have an allergy, which is very rare. So herbs are individual, and I might say that lemon balm is great for this or great for that, but if it doesn't suit you, or it doesn't work for you, or it doesn't work for you by itself, it may be that if you combine lemon balm and chamomile, that might just do the trick for you. So using herbal medicines is very much about gaining your own experience in expertise in being you. Okay. So I'm going to start by talking about food, fiber, and fun, and the three doctors, which are Dr. Diet, Dr. Quiet, and Dr. Laughter. These were three doctors that were described from the Middle Ages. Dr. Diet, we load to talk about that, all great. Dr. Quiet, reflection, prayer, a little bit of fasting. While you're picking your hawthorn leaves, sit at the back, at the bottom of the tree. That's a bit difficult with the hawthorn, it might be a bit prickly. Sit in front of the tree or the shrub. Hawthorns can grow very big and very tall. We usually cut them in hedgerow size, but they're quite substantial, and absorb the experience of the tree, look at the sky through the leaves, see how the energy of the tree is reflected in your own physical energy and body, and where it roots you. Does it root your mind? Does it affect your digestion? Does it ground you? I think a lot of the time we need grounded because we live in our heads. So Dr. Diet, Dr. Quiet, and Dr. Laughter. And this can be canned laughter. You can just put on the laughing policeman, or laughing babies, or chuckling toddlers, or the antics of newborn chicks, which I saw this morning. Thank you, Eula. And anything that makes you laugh or smile. And you can smile while you reflect and meditate. It's all good. Our brains don't know why we're laughing. They just know that we're laughing, and that changes all the brain chemistry. So they go back to the 15th, 16th century. Very clever professors sitting in a courtyard, Salerno University in northern Italy, going, what keeps people healthy? Going back before that to Hippocrates. This is your food be your medicine, and your medicine be your food. But we live in a different time today. We live in a time where we have electric light going all night long, and we're never in darkness unless we live in rural Ireland and can actually see the starlight, and I hope you're all appreciating it, or rural, wherever you are in the world. That is actually very refreshing to the soul to be able to see the stars. and Dr. Movement. I was listening to a lovely YouTube of a doctor who was in the 70s, and he was still practicing medicine into his 90s. And he was saying that people were less healthy because they weren't walking. Okay, in years gone by, everybody walked everywhere, and people rarely went beyond 15 miles from their local village, which was a bit like what we're experiencing at the moment as I'm recording this in the times of COVID lockdowns, hopefully coming to an end. So they write those down: Dr. Diet, Dr. Quiet, Dr. Laughter, Dr. Sleep. Sleep means you go to bed at a regular time, except when there's an exceptional party on, we're looking to the future, or a good time to be had. But in the main routine, you're sleeping at a regular time, in the dark, not with your phone on. And Dr. Movement, you're going up and down stairs, you're walking to the local shops, you're interacting with people as you go. That all keeps the same. And the menopause is no different from that. So another way, I invented the Dr. Sleep and Dr. Movement. I added them. I didn't invent them, of course, but I added them to the core things that we need. The same way you have core muscles, we have core practices that keep us well, and food is one of them, Dr. Diet. So you've had lots about that. So the one thing I also talk about, the 3 Fs, the food, fiber, and fun. The menopause is a transition in life. It's not a deficiency disease. We are not deficient in anything. We're living longer, mainly because of public sanitation and available food. This next generation may not live as long as their parents because of the influences of everything from hormone disruptors, pesticides, junk food, no movement, all of those things. So our health is our own choice in many ways. I'm not talking about expensive food. I'm talking about sardines and fiber and also food foraging, which also gets you walking, it gets you in contact with nature. It's all the good stuff. The other thing that with all of the disastrous catastrophizing about the menopause, you would swear that everybody collapsed for 3 or 4 years and wasn't able to function and whatever. And that's not the case. A lot of women don't have many problems. They keep going. They don't know what we're talking about. And that, I've always quoted 30, 30, 30 as my clinical experience. But that does mean that 30% of women have mild to moderate symptoms and 30% have severe symptoms. And if you have severe symptoms, by God, it does feel like a catastrophe. But we don't have to catastrophize everybody. We do have to help the people who are in the mild to moderate and moderate severe. And using herbal medicines, I have found, it's my experience that people move from the moderate to the mild. And if they have severe problems, they move from the severe to the moderate. And if they persist with good practice and using the herbs for support and changing their lifestyles, then they can go from the moderate to the mild. By the time people have mild symptoms, they kind of go back to their usual little peccadillos of lifestyle things, because that doesn't interfere with their life. Pain and discomfort is a great motivator for change. But that's okay. I mean, nobody's going to chase every last hot flush down to the ground and not have a glass of wine with their meal on a Saturday. So by that stage, people are kind of modulating what's good for them. So I'm going to tell you about our blends, and then I'll work backwards. And I'll say at this stage that there is evidence for many or most of these herbs. I base my practice on traditional medicine. Because science doesn't have all the answers. Science is useful, but it's not dogma. It becomes oppressive and imprisoned when it becomes a dogma. Where all medicines throughout the ages have been heterogeneous and pleiotropic, right? So they have lots of people have physical therapies, people go into salt mines, people use essential oils going back to ancient Egypt. There's massage, reflexology is, does it for me, whatever does it for you. But there isn't just one answer. Herbal medicine doesn't have all the answers, and that has limitations. And I would combine what I do with the Pilates, with referring people for other expertise with Pilates and acupuncture and nutrition. So but there are basics. And if you follow the basics, if you're in the severe category, you might need multiple approaches. But the vast majority of people with mild to moderate, they find a niche that works for them. Homeopathy, some people find very, very useful as well. So what herbs have I selected for a variety of reasons, including regulations and legislation and what's a food and what's not a food. So some herbs I'm able to put into over-the-counter blends. Some herbs you will need to come and see a herbal medicine practitioner who's well qualified. Okay, so the blend, and the other thing to say is that these are for a background of terrain of women's hormones, which so we're doing food, which I represent as the Hormone Olympics. So I'll come back to that. And this is within a wider category of resilience, adaptogens, liver detoxification, gut mobility, gut microbiome, that some of the other speakers have, and everything that we're saying kind of interconnects with each other. These blends are helpful for PMS, menopause, polycystic ovaries, endometriosis, because some people, their default defective system is their allergies. For some people, it's their musculoskeletal system. For some people, it's autoimmunity. For other people, it might be migraine or psoriasis that will come into autoimmune. So for some people, it's kind of like their first irritable bowel is a very common one as well. So their first default for I'm not balanced well is their hormone system, and particularly with PMS and not the structural gynecological problems. And all of this can be used in conjunction with things recommended by your GP, your gynecologist. You show them what you're taking, and there are very few contraindications, but I always encourage people to make sure that they discuss it with all their health and medical professionals. So this is, I think Lara earlier alluded to the funfair of hormones, and even this isn't dynamic enough. Usually when I learn about hormone balance, it's up and down lines, arrows going up and downs and a few sideways, but rarely interlinking, a bit like the hormones. So if you imagine these, they're not all equal. Some of them have a bigger effect or a smaller effect. Some of them move faster. Some of them go with daily circadian rhythms, monthly rhythms, 24-hour rhythms. Sorry, that's the daily. Seasonal rhythms. Some even are affected by the weather that influence osteoarthritis. And migraine is influenced by thunderstorms. So we're continuous with our environment and continuous with other people through the soil, through the food that we eat. So don't be lonely, okay? If you feel you're going crazy going through the menopause, don't feel lonely, okay? I have known many people who feel like they are going absolutely totally out of their mind crazy going through the menopause. And estrogen does have an effect on our cognition, on our minds, and how we react, our resilience, our reactivity. It has an influence on all of those, the estrogen, progesterone, prolactin, FSH. And the issue is that they're flying all over the place. They're fluctuating up and down, causing and round in circles, and that this is creating a lot of work for the body. And if we're not in tip-top optimal shape, we're not capable of doing that extra work. It's like moving in and doing earthworks. So I'll just talk through this slide. This is where what happens in our hormone Olympics relates to the pineal gland at the top, the hypothalamus, the pituitary. I always put the adrenal gland and in the middle of the bottom, because a lot of women get trouble with their thyroid gland and with their sugar metabolism. And my how I picture it is that these are all protecting our survival hormone system, which is the adrenal gland. All of these are influenced on either side by sex hormones, and then by a whole conglomeration of fat cells, the microbiome, the gut, I forget what was the other S was, and the skin, along with lots of others. You know, these are, if any of you want to look at how complex all of this is, just look up the KEGG metabolism, and you'll see a myriad of pathways that, and there's lots of scientists out there studying small aspects of it and coming up with wonder this, that, and the other. But the distance between a laboratory bench and a bedside is very distant. And the clinical problems are human problems. So that's some of the limitations of science. There's books written about the limitations of science, and we all recognize the usefulness as well. I love science. I love order. So that's now, if you want the science behind a lot of the herbs that I'm going to mention, I have a whole 60 slides on hormone solutions, including the menopause. And if you email us, we can send them to you at any time. Okay. So you've had talks earlier today about thyroid and cholesterol, sterols and plant sterols. I absolutely agree with previous speakers. I encourage people to take a plant, lots of plants in their diets, lots of variety of plants in their diet, more vegetables than fruit. Because fruit is nature's candy. Don't be afraid of fat. Fat is part of a holistic diet, and protein, fermented soya, non-GMO if possible. Natto is another form of science of soy, if you're lucky enough to be able to get it. I can't resource it locally, but it's also got a lot of evidence for the keeping the cardiovascular system well. So the herbs are fiber and bitters, digestion. I'll come back to that. Well, I won't. I'll go back to it now. When I talk about food, I don't know. I was dipping in and out this morning trying to organize my own talk as well. So if nobody has emphasized fiber, it's what I will definitely add to the equation. Fiber, 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 and bitters, digestion. Whether you suffer from arthritis, migraine, eczema, autoimmune conditions, herbalists will talk fiber, bitters, digestion. And this is just so relevant. Our microflora, how it digests estrogen is directly influenced, and many hormone chemical synthetic preparations is influenced by the microflora and the digestion. Oh, no, not that one. Oh, I'm just a bit stuck here. Okay. All right. So the best way of getting fiber is oat bran and psyllium husks. These are very neutral foods. The wheat bran is too harsh. And I absolutely love slippery elm bark and mallow root powder because it's good for all of the mucous membranes, including the vagina. It's good for cystitis. It's good for the lungs. And the mallow root powder is, they're both between them a prebiotic. Need I mention the essential fatty acids, the oily fish, nuts and seeds, and avocado. And what you want is a daily bowel motion without stimulants, for example, caffeine or nicotine. Caffeine and the menopause do not go. And if I was to give you one thing to improve your health through the menopause and beyond, it's give up smoking if you're a smoker. Very hard on your system, causing you problems, not solving anything, and it is tough, okay? I've struggled with it on and off throughout the years. So funnily enough, gave it up for 25 years and then took it up at the menopause, and it took me another 7 years to kick them again. So the menopause does, and it was to do with liberation and children growing up and leaving, and see our minds. What can I tell you? We're all. It's all much more complicated than just reading a PowerPoint slide. That's all I can say. So we're going on to some of the herbs. This is sage, red clover. They're all out in your gardens as you walk past. Pick those flowers and put them in your teapot. Angelica sinensis. No, this is peony. This is such a lovely, it's very, very nice to grow, but it's also a very good herb. This is Schisandra berries, which are adaptogens. Dandelion, there's root in the blend. This is the herbal blend. Okay, this is what I'm going through. This is available all together. You please do, this is about you looking after you. If you can go and harvest your own, I would be so pleased. I use this slide, there's the dandelions down in the corner, but this is a dandelion emerging through concrete. People think that herbs are a bit waffly, a bit gentle, you know, so slow. It's like, just not worth bothering with. This completely disproves this. Herbs are so powerful that this dandelion root is making its way through tarmac. And this is how it works in the body as well. It clears, it pushes, it's gentle but firm. I explain that to people, like if I wanted you to move from over there to here, I could go and say, give me your hand, and I could give you a yank, and you would end up over here beside me. If I was to go over and say to you, I'd like you to go in this direction, I'm just going to guide you there, put my hand on the small of your back, take your forearm and say, please come with me. We would both travel the distance and you would end up here. Doing things with a chemical level of interaction is a yank and a suppression. Doing things by way of the dandelion is supported, slower but firm. And you know what? Both people end up in the same place. So that's just a way of describing. But dandelion root is in the blend and dandelion leaf is in the tea, the women's tea. All right. And this is the Siberian ginseng, related to Panax ginseng, but very different. This is about an energy herb. I'll go into that later. I'm just going to show you the pretty slides, especially after all the head stuff this morning. Look, wouldn't you feel better just looking at this? This, of course, is lavender. And I just want you to imagine smelling it. And also, I don't think anybody has covered using essential oils. Burning, there's two herbs that I like around the menopause. One is essential oils to burn in a streamer, or if you're using the burner, candle burners, make sure they're beeswax. Or soya, something that's not petrochemical based. And clary sage and marjoram. And for the libido, it would be lang ylang. These are very nice. The citrus are very nice as well. And they're very nice in the household rooms. But lavender, we use the flowers in a tincture or a tea. This is bacoba. And I particularly use this for cognition, because this is something that's rarely comes up is just this word disassociation. I remember saying to people, you go through the hospital in Galway and at the things the cargoes go around, the roundabout. Yes, the roundabout, losing words and forgetting names, which is a very common thing for people to complain of. So the bacoba is in there for that. This is the Chinese Angelica sinensis or Dong Quai. And this is chaste tree. This isn't in the blend, but I wanted to talk about that anyway. So there's some of the pretty pictures. And now I'm going to go through. I'm going to just go through another analogy for the menopause, because people go, is it a disease? Is it a deficiency? Is it a whatever? And I describe it as a reorganization. And a reorganization is a period of transition and then adaptation. And if you would imagine the Aviva Stadium or any other stadium they've ever been in that has the four sides, it's like one of the stadiums, there's a melting over 18, 24, 36 months, a gradual melting of all these chairs and steel girders and whatever. And then all of the rest of the seats in the other 3 stands have to be moved to replace these seats in the stand. So there's less seats all around the stadium. It accommodates less people, but all of the stadium, the seats are evenly distributed. And all of this while the game is in play. Okay, so we have to keep going to work and managing our accounts, managing our households, phoning mum, phoning the kids in Australia, whatever. So everything has to keep moving on. And that's a good description of it. Does it get to be stable again? Good news? Yes. The extra good news, it's a great place to be. You suddenly, it's a difficult, the transition, as we say, can be difficult for a lot of people, feel almost impossible for some. But when you get through it, there is a living life without the roller coaster of hormones. And you look back and you go, holy God, how did I ever manage that? How did I manage to work, bring up kids, do whatever? While all that was going on every month. And you get a real appreciation for what women do during those fertile years. But with it also comes a clarity, of a clarity of, it's like an absence of confusion more than a clarity. And I've heard a lot of women say this and report it in books, and this is the knowledge that's being shared, that this isn't an ending, it's a transition and a beginning. So this is not a time to, this is a different time of empowerment. And we need to be empowered. We need to be talking about not just sustainability, but regeneration. We need to be changing things drastically. We need to be challenging things drastically, not be afraid of our own voices. This is about finding the voice of the mature women who need to be guiding the world. All right. So anything that I can do to help any of you find that voice, find that clarity, through this period of transition. Now, the adaptation, if this adaptation isn't happening, I would say you definitely need help. This is not fun, and help is available. Okay, so that's what I would say. In the middle of this hormone Olympics, overlapping in the middle of this Venn diagram is vitamin D, right? If you place it between the hypothalamus and the pituitary, then all of that interlocking area, which includes the pineal gland and the adrenal and the pancreas and the thyroid, you have the actions of vitamin D, okay? So there's ways to get vitamin D. I was out this morning in my bra and shorts getting 10 minutes of sunshine direct. That's the best way to get it. It takes longer to burn. It also takes longer to absorb the vitamin D. But people being afraid of the sun, people should be afraid of burning in the sun, but not afraid of the sun. All right. So, and the other thing that you can do is lean forward over a cushion where the neighbors can't overlook you, and get the sun on your bum, the back of your thighs, and all the areas in between, the down belows. Because when it's about the shame, it very much undoes that shame, because down there has been so unmentionable for so long. It's lovely to see it being liberated. I think we should liberate down there. While we're talking about down there, we also have a vaginal dryness cream, which contains, where's it gone? Marigold, chamomile, comfrey cream, St. John's wort oil, and wild yam. They're all suitable for down there, but you can use anything There's other moisturizers and lubricants that you can get. Always check the ingredients. This is all natural. And the marigold is restorative. The chamomile is again restorative, anti-itch, anti-irritation. Comfrey is very deep for moisturizing for the tissues underneath the dermis. It's known as knit bone. St. John's wort oil is very good for the nerve endings and healing. And wild yam is where they make the synthetic estrogen from. All of these progesterone creams were very popular. They were never I loved it when people said they helped. But it's actually a synthetic derivative from estrogens found in wild yam, whereas wild yam is an estrogen producing plant. All of these plants are generous. They're generous. We have learned to co-evolve with plants so that they are generous to us and we are generous. We serve a function for them in distributing their seeds and management and all the rest of it. They give us a lot more than we give them, because we're just another animal that passes by and catches the birds and spreads them and, you know, clears drains so that, you know, they're distributed through water channels and whatever. They are very generous to us, I think, out of proportion. I believe in abundance. You know, the sun is abundant. The sun changes all of the nature's inert objects and gases and into food and medicine for us. And this is a good worldview for the menopause in an abundancy. So why do these herbs work? If I was to choose herbal actions that would be useful during the menopause, my list would be, I would want to support the liver. I'd like to produce more bile. And the liver would be detoxifying enzymes. And the bile is because it's a laxative and it normalizes bowel function. But it also is part of the eliminating cholesterol, which is all part of the inflammatory pathways. And there is also a secondary recirculation. If the breakdown products of hormones are not eliminated in the bile and are not combined with fiber, they go through the colon and they're reabsorbed. So the body has to do the work twice or 3 times or 4 times. I don't know that. I don't think they followed it that long. But you can see how increasing detoxification enzymes in the liver using bitter herbs and also stimulating the bile would have a direct effect on balancing the hormones. A lot of this is about the relative balance of the different hormones and managing the rate of change, right? So managing these major fluctuations so that they're smoother and more like roundabout hills rather than going up and down Mount Everest. So plants are coming into their own, aren't they? We've had a lot of talk about plant estrogen foods. I've talked about the fiber, the sleep, the exercise. The other thing is that we need fat cells, as one of the other speakers. Isn't it great to know that we need fat cells? Not too many of them, everything in moderation. But we also need to influence the kidneys because this influences fluid balance. Now, many of you know that the hormones influence fluid balance through the kidneys because of water retention. Many women experience water retention as part of the menstrual cycle. So if we look at the herbs that I've talked about, we've talked about liver detox would be the dandelion root. Bile bitters would be the dandelion root. Nervines is the rose and the lavender. Adaptogens for energy is the Siberian ginseng, and for cognition would be bacoba. And these are this blend is quite heavily balanced towards liver clearing and adaptogens. Then hormone balance would be addressed by red clover, Chinese angelica, and support for the thyroid gland in bladderwrack. Now, this is not mega doses of kelp, because many of you might think that, oh, bladderwrack might be a problem with the tendency to thyroid. Tara's going to bring me in some questions. So guys, if you have any questions, I'll be coming up to questions soon. Just send them in on the chat. So bladderwrack. So this is the equivalent. It's 20 mils of tincture, which is 3 mils a day of a solution of bladderwrack, 4 to 1 with water. So you can see that this is one of the things about herbs, is that they work in small doses. They do have a dose related effect for many herbs. But for many herbs, the dose, it looks like the dose is too low to be effective. Now, they've solved some of that understanding by realizing, for instance, with which herbs? With willow. Willow contains salicylic acid, but not enough salicylic acid to account for its clinical effect. So they now realize that some of the other constituents are additive or synergistic with the salicylic acid. So they kind of work like boosters. In the absence of them, the salicylic acid would be too low. There's also a hormesis effect, whereby a very small dose of something has a different effect from a very large dose. And that picture there is chaste tree. And as herbalists, we've learned that a small dose can have one effect and a bigger dose can have a different effect. So the dose can be important. So these are all used in traditional medicine doses. So even though there might be evidence from some extract from some herb which is in keeping with its traditional effect, I'm actually using them in traditional doses because I've read enough research to realize that this is the one thing that's much more consistent, as opposed to the limitations of tiny points of information, which are very interesting and mostly support, almost, invariably support the actions according to tradition. So I use the traditional doses. So this bladderwrack is a particular support for the thyroid gland, because a lot of women present with thyroid problems at the time of the menopause. I forgot to mention some of the things that get better at the menopause. Migraine gets better at the menopause, and all of those PMS problems get better at the menopause. Endometriosis gets better at the menopause. PCOS is no longer a problem at the menopause, except that PCOS always indicates a sugar metabolism problem with the pancreas. So you can see from my hormone Olympics that the two issues that occur most commonly is the thyroid and the pancreas, to do with hormone balance, and they are guarding the adrenals. And that's why these blends have such an emphasis on the adaptogens. And then we have anti-inflammatories and antioxidants, and sage would fit both of those. It's also an antimicrobial, which might be very useful for the normalizing the gut flora. A few other herbs that I'll put a shout out for. One is St. John's wort. People think that St. John's wort is illegal in Ireland. It's not. It can be prescribed by any herbalist. For people with very severe depression at the time of the menopause, I use it. Not as often as you might think, because more usually depression at the time of the menopause is exhaustion. Exhaustion from all of this metabolic work that we're doing, and the anxiety that often is associated with the menopause. So when I use the St. John's wort, it's for exhaustion rather than depression. So but both of those are used. Oh, fibroids do get better at the menopause. Thanks very much for that chat. I just saw it as it came in there. St. John's wort, it can be very helpful, but not usually just by itself. Again, all of these, I find they give, it's like a bicycle that's going all over the place. If you imagine a toddler on a bike, and you put the stabilizers on, and then as you use the herbs, you can gradually lift the stabilizers higher and higher until you're feeling better, whether it's over-the-counter blends, individual herbs, combining it with reflexology. As I say, I put all of these together because people didn't come in and say, can I have one herb? They've never heard of bacopa, they've never heard, they don't know what an adaptogen is. So they come in and they say, I'm getting hot flushes, I can't sleep, and I'm pretty miserable. And we would recommend the women's blend. They don't need a whole hour's consultation. If it's mild to moderate, usually they come in over a few months, and then we gradually don't see them until they get a chest infection or whatever. Or hopefully we never see them again because they stay well. So that's the why these, and they've been there. We've had to change them at one stage again to do with what we're allowed to put in a bottle. And we can't say that it manages any medical condition. It doesn't. They're food supplements, and it's about balancing and terrain, and gently, in the same way that a food will, if you're well fed and have optimum nutrition, you'll have less problems of the menopause, I would guess, but also they would have a helpful and supportive effect on your metabolism. Motherwort, we use specifically for palpitations and anxiety, and it's a nervine. I use a combination of motherwort and lemon balm and dandelion root as a blend for balancing and protecting for the adrenal gland when people present either with burnout or the menopause, because they're kind of in adrenal exhaustion. Okay. The herb tea, I've shown you this, but what we've done is, and this is 2 weeks supply, and what we've done is we have resourced large tea sachets, which are a bit like a bath sachet, and there's 3 teaspoons in each tea bag for convenience, and we also have them in as a loose herb. I can't put my hand to them, so which are a bit less expensive because obviously we pay somebody to come in and do this and put the tea in each individual bag. You can also get it loose, do it in your teapot, love it. I've just found that the compliance with the loose teas is gone up like 80% since developing this system. And I can understand why. Fishing out tea leaves is not part of our current cultural experience, and it can be a bit tedious no matter how we do it, filling the little tea balls, and I just find that gives us greater compliance. So what's in this? It's red clover, wild oats, so a hormone balance in red clover, nervines in wild oats. Wild oats are lovely, lovely herb for the any hormone imbalance, and rose petals, and lavender petals. So if you have these in your garden, just put them in your teapot. Very, very nice. When the world feels so chaotic and disturbed, and you can't trust your own to know what your body is doing day on day, and for it to be acting so strangely. For us is those medicinal flowers are very, very soothing, and it's like regenerative medicine. It's not just sustaining, it kind of gives us the abundance above and beyond. We use yarrow, which is very good for pelvic congestion. As I say, these teas are suitable for all female hormone balance issues. So around the time of the menopause, the yarrow is very good, especially if you're having irregular periods or heavier periods. So this would be very good for pelvic congestion, varicose, they're good for varicose veins anyway, but vein congestion, including in the pelvis. And then for fluid balance, there is, and bitter, there are the dandelion leaves. Now, any of you want to go out, pick your lavender flowers, pick your rose petals, wild oats you might find in some of the hedgerows that have been growing crops. I love that. And nettle is also very good, so long as you don't have a very hot. These are designed to suit a very general constitution. If you're somebody who has a very hot constitution, the nettles might not suit you. Okay. So I think that's what I had on the agenda to speak of. And again, I'll remind you, if you want the details of some of the research that underpins a lot of what I've been saying, or why I might have chosen these herbs in conjunction with traditional practice, send us an email and we will send you the PowerPoint. A good face wash. I recommend rose water and witch hazel, a mixture of both, and we can send them from here. And I just use them on organic cotton wool, and I just clean, okay? And then I use if you want my tips, then I use licorice cream. And we have that in the fridge here. I'll show it to you. Oh, it's called brightening cream. And this has got no preservatives, or the minimum amount of preservatives, and they're as natural as possible, as often as possible. You keep it in the fridge, and if you want to keep it out of the fridge, don't put your finger in it, because it's your fingers that actually contaminate the creams. You use the tip of a spoon or a wooden stick, like a lollipop stick, and just put a bit on and then throw away the stick. So otherwise you can put it into a much smaller container and put it in your handbag. It's fine for a few days, but you wouldn't want to be dipping in and out of it with your finger out of the fridge over 3 months. So that's the practicality to do with that. And the other thing I use is the comfrey balm once or twice a week. And that is very deep conditioning for your skin, for your and don't forget to moisturize your fanny. All right, because everybody moisturizes everything else and pretends that personal isn't there. You know, in my day, you washed possible above, possible below, and then you washed possible. So do the same with the moisturizer. And very good for maintaining sexual activity, because the dryness can be a bother. Vaginal dryness, chaste tree, I was going to talk about. Chaste tree and black cohosh together have research on maintaining lubrication. And the other thing I recommend is aloe vera gel. Tara, have we got aloe vera gel there? We've loads of ideas. And phone and ask, you know, if there's something that you want. Best for fluid retention, morning okay, and tight fit by evening time. Thanks, Kathy. This is a digestive problem, and I will probably fluid retention, morning okay. This is really the digestive tea and bitter herbs, including dandelion leaves. In your salad, 1 or 2 in your salad. You can't tolerate much more than that. And actually, yeah, probably the hormone tea, the women's tea would probably be help, because it has a digestive and nervine hormone balance. The yarrow is good for all pelvic congestion, so that, and it's also a diuretic, and the fluid balances. So I'd probably suggest the women's tea. Now, how long do you use these? How long is a piece of string? The menopause, all that flushes isn't the menopause. So most people, it's like saying puberty. How long does puberty last? Puberty lasts, you know, 2, 3, 4 years, but beyond 4 years, you're not saying that a 17-year-old is still going through puberty. I find the same with the menopause. Most women over 3 years. You might count some more months leading into it, some more weaning off. I still get an occasional hot flush, and I just open the window, yeah, once or twice a month. But that's probably adrenal. You know, I think if it's prolonged after the menopause, then you're talking about adrenal, the adrenal coping mechanisms. Any moisturizer on the vagina? You just try, I mean, the least preservatives possible. That makes sense. And as pure as possible. I was going to show you the aloe vera gel. This is also very nice. And that would make a nice moisturizer. And I also recommend this for a lubricant for intercourse. Make willies work. they're a delivery system, or whatever is is part of the action. So can use any moisturizer. I mean, I probably wouldn't use Vaseline because it's a petroleum product. With a lot of preservatives. So I would just use the same, they're like value systems that you would apply, but that area is, I mean, we put the mucosa in our vulva is the equivalent of what's in our lips. So people put lipstick based on all kinds of petrochemicals on their lips. So it's not a particularly sensitive area. If a little goes into the vagina, it's like a little bit going in and show all the chemicals that are in toothpaste. But I would use the licorice cream, marigold cream, comfrey cream, aloe vera gel, or any of the much lower chemical, but that's to do with the environment as well. Osteoprevention tips, that's a whole other webinar, which we might do. Everything that Breda and Linda and Lara and I have told you will make a big influence. We're talking about micro-inflammatory terrain, and the water, the vegetables, all of that, and the movement, and the sleep. Okay, sleep is restorative. If you want to do your own system of regenerative medicine, we're talking sleep. If you want a reference, it's betterbones.com. Now, originally there was very little sales on it, so but there's a lot of blogs that are very informative. It's an American site. She's very, very informative about that. We have a bone tea, which are just herbs that have a very high level of minerals in them, including silica, like the horsetail, silica, calcium. So they're you know, they've been known to be strengthening for bones and healing bones for 1,500 years, and lo and behold, when they look at what all the constituents are, they are actually full of minerals and bone strengthening constituents. So we have a bone tea. We also, some women experience cystitis, so we also have a cystone tea. So just contact us. You know, I can't show you everything today. We also have a hot flash spray, which we call a cool skin spray. Now this is very practical and very useful because you just, there, oh, that is nice. And you can use that, you know, before you go into a restaurant, when you know you're going to do something which stimulates your emotions, whether it's a difficult phone call. I'm sure you all experience that the hot flashes happen if you're particularly emotional. And now you can see why, because you have all of the nervine brain transmitters going into turmoil, in addition to all of our background hormones in a state of high activity. We have the chaste-free capsules. We also have various things to help sleep. The Relax Blend is brilliant for the anxiety. And if you want to, if you have very severe symptoms, or if you have a particular aspect, or you've tried the hormone, the women's blend and tea over 6 weeks, then make an appointment and see a medical herbalist. So Kathy asks, if you're on HRT, how long do you stay on it? I'm not anti-HRT. And for people with severe symptoms who also have, for instance, IBS and allergies or migraine or whatever, it makes sense to stabilize the hormone system by suppressing all of those fluctuations while you work on the digestive system. So it's very individual. Often people come to me determined not to go on HRT, but I actually, if you like, talk them into it. because you need your resources in order to change your life. And it's very difficult to do that when you're in a state of imbalance, you know, to the extent of not functioning. And that can happen, as we all know from listening to Joe Duffy. So how long do you stay on it? So I would say you stay on it for as long as, like when people come to see me, it's when their digestion settles and their other things are calming down, and they're eating well and moving properly, then I would withdraw it. If it becomes terrible again, I go back on a higher dose. So it can wean off from anything from 3 months to a year. I have heard a GP saying that it doesn't happen, that if people are on HRT and then they stop, that the menopause comes back because you haven't actually dealt with it. My experience of women is that, you know, whether they've been on the HRT for 3 months or a year or 18 months, when they stop the HRT, they haven't necessarily gone through the menopause. Now, I'm only seeing the women that have continued to have problems. I don't see the women who haven't, right? That the 18 months has passed or the 3 years have passed. So all of this has to be individualized. This is all personalized medicine. So it's not a one thing fits everybody. So you're an expert on you. N equals 1. So you can discuss with the HRT prescriber and say, look, I'd just like a break. I'm not managing. Things are totally overwhelming. I need to kind of start some other things in motion. If you don't do anything else, if you just take the HRT and you keep eating sugar and you don't move and you don't, you know, kind of support your sleep and you don't do any of these things, I would say there's a high likelihood, because you haven't changed anything from before you went on the HRT. So it depends on how much balancing you get done while you're on the HRT. I hope that helps, Kathy. I think, is this for me?
Yes, that's
okay. So Tara has asked me to mention, yeah, do ask in your local health food store or pharmacy about women's blend or tea, and if not stocked, you can ask them to do so, because I really want people to be helped all over the country. Our website is, oh, I have all this. Tara will be so proud of me. This is just to let you know that if you're interested in learning herbal medicine, I teach on Heartwood, Herbal Medicine Professional course. If you want an introduction to herbal medicine to see what it's like, there's actually an introductory course for everybody. And there's also an introductory course to herbal medicine on Dr. Clare's Academy website. That's the outside of the building. I'm waving to you there from the bottom window. This is where I am. Always nice to see where people are. We have the women blend, women's tea, vaginal dryness tea, chastery, tinctures, bitters detox. If the main problem is that you're not getting fiber and detox, that might be more relevant to you. The digestive blends, the relax blend. So we really have an apothecary here for all of the common things that ail people. So whether it's recurring cystitis or digestive problems or sinuses, recurring chest infections, immune blend. I'm looking behind me to see what else we have. Don't hesitate to get in touch with us. There's lots of articles and blogs on the website. And this is how to contact us. So I'll leave that up there. And Tara works very hard to keep you all informed. And Michelle on Instagram. And our flagship store is in Galway. We will distribute to pharmacies and health food stores, so be sure and ask them. Enjoy the lovely day out there, and or wherever you are and whenever you are, and that's all from us.